Holy crap. Knock it off with the comments. I swear to God, I opened up the public comments because I've been getting a lot of really valid medical questions concerning this illness and whatnot. But if y'all can't be nice, I'm just going to shut the shit back off. This is ridiculous. Grow up, because you're not going to do it on my damn page. If you want to start a decent conversation about rights and all that stuff, great. That is perfectly fine. But don't be disrespectful. I'm effing tired of it. Janice, this isn't the effing flu. I don't know how many times I have to get this through people's freaking heads. The flu has an antiviral. The flu has a medication that we can treat it with and a vaccine. We have nothing. Hey guys, not a fucking thing. Knock it off. I swear to God, where do you get your information from? Dr. Google isn't the answer. You know, I really blame the media anymore. I really miss the old days when they reported the news, the facts, you know, the actual facts, and you could weigh the evidence for yourself. Educate people on how to look at a research paper, look at the statistics, look at the credibility, and find out if that medical article is actually valid or if it's skewed. Hi, Jim. But we're not doing that anymore. We're just like, here, we're going to make up all sorts of shit and see what the American people can believe. And now we got other countries thinking that we're out of our goddamn minds. And what the hell, Michigan? What the hell? You have like 200 protesters from a group of people with Confederate flags. I'm sorry, but Michigan wasn't in the Confederacy. The Nazi flag. This is just ridiculous. I drive Uber in my spare time when I'm back home because I enjoy talking to my soldiers. And I talk to them, and a lot of them like to go back over to Germany, which is a police state. You know why? Because people fucking police themselves. They drive decently. They get the hell out of the fast lane when you're coming up behind them. They do things because they know if they don't, there's going to be consequences for their goddamn actions. Unlike the American people, they can just get out there and spit in somebody's fucking face because that image of those protesters in those police officers' face, those cops are standing there just like our soldiers do, and they take this shit. But you know what they're not wearing? Eye protection. This is a droplet virus. We're all running around wearing face masks to keep this shit from spreading, and they're right in this person's face exactly how we don't want you to be because social distancing. And they're up in their face. You know how many of them people, if they're symptomatic, can spread that to those cops? We won't know for a few weeks. F you. And what the hell are you even doing standing on a balcony? I'm going to share these images when I go back to the YouTube video because I can't share them on the Facebook Live video, but when I download it, I can edit it and put the pictures in so you can see exactly what the images that I'm talking about. But they're walking around with rifles slung over their shoulder like this has become a Second Amendment rights issue. What the hell are you doing? These people are showing up to try and make some kind of hate statement because that's what this was a hate group. They are not Republican. They are not Democrat. And what the hell you vote for shouldn't define who the hell you are. You are an individual with a point of view and you have your value system and that's who you vote for. And please educate yourself about who you're voting for because it's our goddamn fault that these people are even in House, Senate. If you don't want them there, do something about it, but don't sit on your freaking computers and be internet warriors and bitch about it. But I'm going to hide every freaking nasty comment that I come across on any of these videos. If you want to have a normal conversation, by all means, have it. I encourage it, but do it respectfully. Who the hell are you to sit there and point fingers at me? What y'all don't realize is my soon-to-be ex-husband that I've known for 23 years is a retired command sergeant major. Multiple Bronze Stars, 82nd Airborne, Paratrooper, Special Forces. That's who I fucking married. So I know about your freedoms and liberties. I know about your Second Amendment rights. I've heard about it, and I do respect them. I started a Facebook page, and that's what started me being able to speak up, is because my husband, soon-to-be ex-husband, who I still love and adore, his frontal lobe is completely freaking damaged. And I started a page called Journey of a Combat Veteran Spouse. And I started to speak up about the issues that families face with PTSD survivors after combat. And I started just telling my crazy story because it's freaking insane. And lots of spouses started reaching out to me saying, this happened to me too. This is going on in my home. There's mental abuse, there's physical abuse, but what's happening to our veterans when they get home and the lack of care, and what's happening to the families who don't get any support from the VA over this is terrible. And now I have frontline workers who are going to be dealing with PTSD. So all of this is going to tie in together. Unity, and we don't need no more negativity. I don't need to see it. I don't give a crap about it because I'm too busy dealing with this shit out here. And you're not. I'm trying to educate. And I get so sick and tired of the negative views. But those people in Michigan doing that was absolute crap. Republicans aren't hate mongers. They're not freaking white supremacists. The Democrats aren't, all welfare rats living in the ghetto voting for people. I mean, stop labeling people. Just stop. We don't need a label. My name is Misty. You all have names. I don't need a label, okay? What you all need to do is learn to respect each other's value system and beliefs. El Paso, I love my community there. I'm a Michigander. I was born and raised in the Metro Detroit area. I have my Up North sweatshirt in the closet, and I'm rocking my El Paso, Texas one right now. But El Paso is a wonderful freaking community, and I'm going to tell you why. There's not much hate there. People aren't labeled. There's a huge transgender, gay, lesbian culture down there, and it's accepted. It is tolerated. People respect each other's differences, and they support one another in the community. I was there for the Walmart shootings. The way that I'm trying to read the comments, but they're flying up on the screen, honey. I'm seeing them, and I'll try to respond to them after the video because they're just kind of going up on the screen. But what's happening around the rest of the country? I mean, when I moved to El Paso, I had a lot of assumptions, like being on the border of Juarez, we were going to have all this violence. It's one of the safest cities in America. It's one of the most friendly until they get behind the wheel of a car. They can't drive. They really can't drive. We have a lot of car accident victims and a lot of drinking and driving, which is a whole nother issue. But the community as a whole, that's why I'm choosing to stay there, is because they are so supportive. And they came around me when my husband and I separated in a very traumatic way. And they took me in their arms and treated me like family. And that's the level of respect that they have for one another and other people. I got some messages from people who are on an Indian reservation. And there's a lady out in Arizona that I was sent, Misty Bedoni or something close to that. I'm sorry, I didn't write the name down. But she's upset because of the reservations and her business is closed. Okay, well, there's another guy in South Dakota who they have no cases on their reservation, and the governor wants to close the borders to the reservation. That's a great idea. Social distancing is in place so we don't put a drain on the healthcare system. Some of these rural communities only have an 8-bed ICU. In Mount Pleasant, Michigan, where I used to work, it's out in the middle of nowhere. And there's just a college campus there, and with these college students who were living close together, we have meningitis situations when they get to the dormitories in the fall when they get there. Hang on, I got to turn off my notifications here so it doesn't interrupt. But social distancing is in place so we don't overwork our healthcare system to the point where they can't take care of people. So he asked what I thought about the border closing to the reservation. If you have no active cases there, it's a great idea to close that border to keep people from bringing it in. Protect your people, because if you're in a reservation, you generally don't have... Oh, thank you, Callie. But they don't have the resources to treat them. If you have, 6 ventilators in a hospital and you have 25 people in your emergency room, then it becomes who do we help save? I mean, what do we do? I've been helpless standing there going, I can't do something for this patient because I don't have the access to it, or we don't have the resources. What the hell do you do? That is the worst damn feeling in the world. So please don't put us in that position to have to make those choices. Please do the social distancing. Peaceful protest is great. maintain your distance. There was an article in the El Paso Times or on the news website. There was a protest in El Paso, and people were violating the 6-foot rule and all these things. And instead of the police getting involved at the time, they are going back to issue citations against those people for violating those things, which is a great idea because it's going to help keep the police safe. Unlike the situation in the Capitol, that should have never happened. There should have been a barrier there so those people weren't up in those cops' faces. I am so freaking pissed off about that. And those gentlemen stood there and took that crap. I am so disgusted. And to even politicize it, those weren't Trump supporters. I'm sorry. Those were not Trump supporters. Those were people in support of their own agenda of hate. And you don't show up with white supremacist things. You don't show up with the Confederate flag. That's got nothing to do with Trump. Knock it off. It's not a political statement. The comments and the private messages, you're not bothering me with those. Thank you, Deanna. I had one that was just a little while ago asking about a plastic bronchitis where it hardens in the airways in the pediatric patients. Yes, it is very similar, but what's happening, this is not the flu. This is a disease of the blood vessels. It's also affecting the brain. We are seeing altered brain activity because of this. It's affecting the respiratory center, which is in the brainstem. That's why I have patients coming in breathing quickly but normal volumes of air, and when we draw their blood, the gases, which would normally be blowing off carbon dioxide, that's what we do the blood gas for, they're normal. There's a reason for that, because they're pulling normal volumes of air. If they were actually hyperventilating, the carbon dioxide would be low and they would be passing out because you get the tingle fingers. You know what happens when you hyperventilate. So we're not seeing these typical, we're seeing a specific set of symptoms with these. Specific. We can't treat that. It's not the flu. I can treat the flu. I can do things to help with the flu. I can't do anything with this. I don't work with pediatric patients. I can't handle it. It is too emotional for me. So the youngest has been like right at adulthood. And to the lady who said he had pre-existing conditions, no, he didn't. He was a healthy football player who had a football scholarship to go to college. He had no pre-existing conditions. And that's another thing. They're showing up in the ER with diabetic ketoacidosis, and they're not even diabetic. Not even freaking close. So we're seeing that too. Thank you, guys. So that's another thing that we're seeing. And people who are screaming about freedoms and liberties in a state of emergency, those are suspended. And in a dictatorship, those are like Kim Jong-un. They extend these things for the duration of their dictatorship. Trump's not a freaking dictator. He's taking shit left and right, trying to do the best he can with what he's got. And the American people not standing behind their country. Okay, JFK, during his inauguration speech, it was short and sweet. And what did he end with? Ask not what your country can do for you. Ask what you can do for your country. That was a public call to action to do something for the greater good of the American people. It is time to wake up and remember these things. You guys are, with everybody focusing on one thing. You're taking one small thing out of a big picture, and just like the media, and you're focusing on that instead of giving people the entire picture to make their own decisions. They're not doing that anymore. I'm not trying to create fear. I'm trying to give you information so you can do what you want with it, but I'm not going to be verbally attacked. I'm not going to be abused. I deal with that shit from the crazy stalker who tried to harass my marriage, which will be dealt with in court. And you can follow that story on the Combat Veteran Spouse page. But I've heard from so many negative people who are non-veterans. I've not heard a damn thing from my veterans except for what they fought for and what they're dealing with. They're at home with health conditions, pre-existing ones, and they're stuck at home because you want them to stay there because they have pre-existing conditions, and we should just shelter everybody at home so people can go out and spread this freaking virus and do what they want because they're being selfish assholes. And I'm going to tell you that right now, it is wrong. Our veterans have put up with so much crap, not being treated with the VA properly, and now you want them to stay at home because they have pre-existing health conditions, and their caregivers have pre-existing health conditions, and they're trying to get things at home, and they're out in the middle of nowhere and don't have resources. So It is not okay to go spread this everywhere because you think that you need to go out and do something. This needs to be rolled out slowly so we can see the reaction, because we cannot afford another drain on an already overly taxed healthcare system. This is ridiculous, and I do understand some of the hospitals are shutting down and furloughing and laying people off. Get on the road and travel. We could use the goddamn help. If you have time to get on the internet and bitch, you can get out here and help, because there are jobs to be had. There was a pharmacist who was posting jobs for a pharmacy technician, couldn't get an applicant because they're sitting at home on a federal stimulus unemployment because, oh God, they're in Michigan. I think the max a week is $384. Plus you're getting an extra $600 for the stimulus because of COVID. Who the hell wants to get off their ass and go work? Yes, Alexandra, you cannot get this. You cannot get this. This would be so bad because it's an inflammatory response of the immune system. The healthier your immune system, the worse this response is, because you have a great immune system to react. And it's causing an oxidative stress situation. And your body's natural mechanism to fight this is impaired by the oxidative stress. So when you have an asthmatic response or a response to this inflammation, it's called we call it a cytokine storm, because you have all these inflammatory markers that happen. And the healthier that immune system, the more it's trying to attack itself. So your body is just arguing with itself and you're getting nowhere. And we have to figure out a way to fight that oxidative stress situation in order to control what's going on with the body. The ventilators are making things worse. If I have to put you on a vent, it's an 80% death rate. I don't want to put you on a ventilator. I would rather be out of a damn job right now than doing what I'm doing, because we lost our nurse last night, the nurse we had in our department, and they put up a fight more than any patient I have had. This person hung with a pH level, normal homeostasis is a 7.4. This person was under 7.0 and hanging in an area where we usually can't see somebody sustain themselves. They were fighting the ultimate damn battle against COVID, and it was the most amazing thing to see, and we were hoping and praying, and we lost him at shift change yesterday. So this is not a goddamn joke. Everybody at work is devastated. I didn't know the nurse personally because I got there in the middle of this shitstorm, but they're all very upset. He had taken the job to help out as a second income, put on the COVID floor and got COVID, and worked at a rehab facility with rehab patients prior to that. People are just distraught. So I'm not seeing the negative reviews from the actual veterans. It's people who think that they're supporting veteran causes. And the veterans, ask the veterans what they think. Ask the frontline workers what's going on. April is a high month for suicide hotline phone calls in general. So now we have a bunch of people stuck at home who are really stuck at home with a spouse that they're not used to being with most of the time, because they're working multiple jobs and trying to raise kids in between, and now everybody's at home. BMT, yeah, immunocompromised is not okay. You got to be careful, especially if somebody's going to get up in your face and spit all over you to give you their opinion. What are you doing? They really should have barricaded those police officers or had a shield like the SWAT officers do, because those people I cannot wait to share the image for those who have not seen it, but it's an image of pure hate and negativity. It was the one that was next door to the 19-year-old Deanna. The one that was running back and forth trying to, right after I sucked out the mucus plug, I had to go run over to that patient. And the lungs are becoming so stiff that we can't put air in there. It takes high pressures to force in the air, and then you're doing more damage to the lungs. The image that I shared of that mucus goober, it has the endothelial tissue of the inside of the airway. And those are already very thin. So when you're ripping out parts of the airway, it's going to hemorrhage. The alveoli, where your gas exchange takes place, where the oxygen and carbon dioxide go through, those are hemorrhaging because of the high pressures and the other things that are going on inside the body. So you have the blood in there. I did not suck that. When you go down with the suction catheter, you can usually hit the carina. This football player is a large man. I could not even reach the carina. I was hitting it up here. Just after the tube, it was stuck down here. And I could not pass the catheter, and I had to put 120 cc's of saline in there, which, let's see, the Coke bottle is 591 ml. So probably about that much water, saline, down the airway to flush it, to just lubricate it enough to get a hold of it and pull it through a tube that's about that big around, with a catheter that's even tinier. So you have to imagine that this is going on in all those branches of the airways, and it's solidifying in there. What would you tell a nurse who does not believe COVID-19 is deadly? I say come to the front lines and take a look at my ICU. They had to open up a section that's normally closed because this is a medical surge hospital. This isn't even the university hospital here. I'm at a smaller hospital. Every patient when I got here was COVID in the ICU, and every room had a ventilator. One nurse before I got here lost 6 patients on a shift. The doctor told me that people were coding in the elevator on the way up to the ICU. Oh, yes, it's very gross. And we get even more nasty secretions out of trach patients. I mean, there's times where I want 2 N95s when I go into a trach patient's room. Pseudomonas does not smell good. My job is not pleasant sometimes. I am a sputum sucker, and the nurses love to come get me because they don't want any sputum. Your cough, when you cough, you have the hairs in your nose, Deanna, they are cilia. You have those in your lungs, and they help to move the mucus out. So when you're on the ventilator, that becomes impaired. You can't cough because we have you so sedated that you don't. Yes, you want to lay on your stomach, Michelle. You do, because proning does help. We are manually proning patients. We are flipping them over, 4 or 5 of us, especially that football player, because we don't have the beds like I do in, some other hospitals, but we're manually doing that. We're even doing it with patients on the floor who are not ventilated. Yes, definitely do that. But your cough mechanism helps you to move that mucus out to the central part of your airway so you can cough it out. On a ventilator patient, it's impaired and they cannot do that. They're so sedated that they have no cough and gag reflex. So what I get is what's here. It's not what's out in all the other areas of your lungs. Yeah, that's exactly right, Rosalind, which is why I agree with closing those Navajo borders and closing those reservations. That lady flipping out about her business being impaired. How about the people on that reservation? You guys are not equipped to deal with it. And if anybody brings that in, it will just devastate the whole damn community, and it will overtax the healthcare system that you do have. Dale, it is hard. It is hard, but I love what I do. I love doing my job. I love to educate. It's really important. People are lacking in education right now, and they are not getting the information that they need from the damn media. I'm looking at these news reports like, I don't care what your opinion is. What are the facts? Where did you get your information from? Like, where can I go look at what you're talking about so I can evaluate whether this is biased or not? And that's another thing. People are biased. They're getting paid to sit on there and tell you their opinion. I'm not getting paid for this. I don't want to get paid for this. I want people to be educated. COVID-19 is not a hoax, Christopher. It is far from a fucking hoax. You come down here, I will invite you to push the bodies to the morgue. Okay? Knock it off with your conspiracy bullshit. This is not the time for it. That's exactly right, Sherry. I've had people message me that they've lost 3 or 4 people. In the Hispanic culture, you have extended family members who live together because they help each other out. So you have aunts and uncles and all their kids and grandparents living together because they do support one. Nebulizing iodine. Hydrogen peroxide, I don't know about any of that. Hydrogen peroxide is a great sterilizer on the outside, but I don't know about the inside. Rachel, when your body is doing this inflammatory thing, and I'll share the video. It's on my Facebook page, but it talks about the oxidative stress, and your body actually produces hydrogen peroxide when you're going through this, and it becomes a part of the oxidative stress problem, and your body has a problem converting these things back. And I am not a biochemist, and it is really hard for me to explain, but the video does a great job of showing how all the molecular cells move, and I'll reshare it again. But MedCram is a great place. It's on YouTube. MedCram, the doctor is awesome. Great information on explaining how this works and what's going on. How does it feel to suffocate? Well, put your head in a plastic bag. Your carbon dioxide levels rise. We call that CO2 narcosis. So hopefully you don't feel it because you're kind of knocked out like a narcotic would do. Mind control, 5G is killing people. Jesus criminy, dude, you're going to get blocked from my goddamn page. I don't even know if I can. Yeah, here we go. Block Christopher. Bye-bye, Christopher. So, how does it feel? COVID kill? Yeah, COVID does kind of kill by suffocation because the airways become so stiff that we cannot put oxygen and the air in there to ventilate. Ventilation occurs, you know, you're moving air. If I cannot move air, I'm just stuffing air into a brick. So I guess that's the best way to explain it. Try blowing up one of those damn punch balloons. You know how tight that is? And as the swelling keeps happening, it just squeezes the airways. And they're tiny. When you get down to these fine branches out in the far distal parts of the airways, they are so tiny. And you just... they're just microscopic capillaries. Just tiny. And what happens is everything shunts. You can't get the blood and the oxygen and everything to move the way it's supposed to. And your carbon dioxide levels rise, and we call it CO2 narcosis. It's a lot like overdosing on heroin or Vicodin or whatever. You kind of narc out, and I can't really tell you how people feel, but you know what it's like not to get air. Essential oils, no garlic, no essential oils. There's nothing that you can really do on the outside other than wash your hands. Please wash your hands. Soap and water, man. Scrub the shit out of them underneath your fingernails. Same thing with hand sanitizer. You need to use it the same way as soap. You need to scrub. You don't just wipe like this and just go. You have to rub it into your fingernails. You have to rub it into the sides of your hand. We miss those a lot. Don't wear gloves in public because you're just spreading this everywhere. You're better off getting it on your hands. You are not going to absorb the virus through your hands. You're just going to spread it everywhere. Don't touch your face. I'm going to try to scroll back through some of these comments. Humidifier helpful at the first symptoms. I would not add any more aerosol. If you are COVID positive, do not aerosolize a damn thing. If you have COVID, you're going to get it in your humidifier and spread it to your family and get it all over the place. We're not nebulizing any medications because of the risk of the aerosol particles spreading into the room and landing on places, and it's not an airborne virus, but it will hold in the air for a certain amount of time. So if you're nebulizing, it's spraying out the end of that nebulizer and landing in other places. So you definitely don't want to do anything that includes aerosolizing. Heard something about this from Dr. Mercola, I believe, in Strange. Yes, we may need unprecedented trials. I don't understand how they're about to end the lockdown. I don't either. We need to roll this out in the areas that are not the hardest hit, and see how things go. And in areas of it, in Michigan, people want to go up and visit their summer homes. And the metro area is just COVID insane right now. But you don't need to drag this up to people who aren't having a problem in their community. I understand that we want to get the hell. It's been 50 days, 51 days. I know it seems like 3 years, but we really have to look at this. Look at what the government has done in a very short period of time. They take us longer to get our damn tax refunds out than they did that stimulus check. Okay, research takes time. We need to research this because it is my personal belief that this was manufactured. This was a virus that they were looking to create for bioterrorism. There's no people's influence on my opinion, this is from what I see, these are very specific symptoms that we can't treat. We have nothing for. Why else would you do this? And how else did this mutate if it wasn't trying to target a specific system that we don't have anything to treat? We're throwing everything at this, trying to get something to stick. So that's my personal opinion, and you can do what you want with that. 5G could cause this to happen to people. We've been dealing with 5G for many, many, many years. Go look at your modem. If you look at your modem, you have a, like, 2G, I think, but you also have a 5G service, and it's been there for a long time. 5G is just faster. I mean, we've went from like 1X, 2X, 3X to LTE to, all the different Gs. This is just another generation. I don't really see how it's affecting anybody other than this. Does menthol and the Vicks help? It might help relieve just some of the symptoms. If you're having a hard time breathing at home, like with the bronchitis, I don't see how it wouldn't help to rub the chest and maybe get some relief of the symptoms. But as for getting rid of COVID, I don't think so. Family member with sleep apnea, is that considered? Yeah, sleep apnea puts you at risk for things like heart disease and stroke. So you definitely want to wear your CPAP unless otherwise advised by your physician not to do it. I would advise cleaning the hell out of it and not running it in the same room as somebody else, especially if you have a humidifier. So if you're COVID positive with symptoms, definitely, sanitize it, vinegar and water. Vinegar and water is a great natural sterilizer if you are out of bleach and Lysol and all those other great things. But wash your CPAP on a daily basis. Make sure you're changing the water, rinse out the chamber. Can you still be negative? But you can be negative like a couple times and then test positive, Missy. I have several patients who have tested negative and then tested positive on the third test. So we have been rapidly producing these tests. We have had no trial phase where we can test their efficacy and accuracy. So they're just expediting all this because people are screaming, we need more tests, we need more this, we need more that. Well, this is what you get. We don't have a time to research and do trial and error and all that stuff. So if you are symptomatic, isolate yourself. That is the best thing that you can do. And then antibody screening. Get the antibody screening. If you think that you have been positive, especially all the way back to January, a lot of people were showing symptoms for this. And they tested negative for the flu. But I bet you if you go back and do the antibody test, you have it. And go donate your plasma because we need it desperately. A convalescent plasma program is helping, and we are using it. I went crazy scrubbing my hands all day tonight. Yes, just please wash your hands. My hands are so dry and chapped. I really like the Gold Bond lotion because that's like, it leaves a layer on my hands, at least after a few more washes, and I can go put it back on. Have a 90 survival rate. If they're not on a ventilator, Gerson, are people with diabetes vulnerable? Yes, you are. If you have any kind of pre-existing conditions, you are more vulnerable. Anything that affects the vessels, a lot of people with diabetes have neuropathy problems. If you're getting COVID, it's affecting your vessels. It's a vessel problem. It's an oxidative stress issue. And if you have diabetic neuropathy, it is not a good thing to have. You could lose a limb. But the survival rate, yes, if you don't wind up on a ventilator. If you wind up on a ventilator, your survival rate is shot in the ass. I don't want you on my vent. I don't want this job right now. I promise you. COVID resemble asthma. They present in many different ways, Carrie. There have been people with gastrointestinal symptoms, fever, cough, shortness of breath, diarrhea, everything. So there is no specific way because it's attacking everything. And those vessels go throughout your whole body, so your body can react to that stress a lot different than other people. So if you are having any symptoms that are out of the normal, by all means, if you can't get tested through your hospital, go find a private facility and go get tested if you think that you have the signs. And isolate yourselves. Don't go out in public. Don't touch your face. Wear a mask. Prevent this from spreading. That's all I can keep telling people. Would I take a vaccine when it first comes out? Absolutely not. We need time to research these vaccines and the side effects. There are long-term things that happen. There are chemicals and things that are put in vaccines. my rants were inspired by Z-Dog. I follow him. Z-Dog MD is a great educator. He is a doctor. He does a lot of public speaking. He's championed the cause between Healthcare 3.0. I do advise going there. He's got great information. But I belong to the Supporter Hub, and we have a lot of live video conversations, and we all have a lot of different points of views, but they're respectable, and people aren't calling each other names, and it's great because he does moderate his page too. So I do advise following him. He's got a lot of great information. He's very informative, and he's very interactive, and he does care about what he's doing. And it's not just a doctor like Dr. Phil and Dr. Oz who are out to make a freaking dollar. So Z-Dog MD, but my rants were inspired by him because he goes on rants, and it's great. But he's also very educational when he does them. So he's my inspiration behind all this. And even he says, don't get the vaccine if it first comes out. Wait at least 5 years. Just wash your hands and stay away from people who are sick. If you are sick during cold and flu season, stay your ass home. We would save so many lives with the flu if people would follow these same behaviors right now. This is what I need you to do from October to March. Stay away from people if you're sick. Don't send your sick children to school. Don't go to work sick and pick up the phone and spread your germs all over the mouse and everything everybody else is touching and touching your face. Just follow these guidelines. We've been asking people to do this for years. This is no big change from what we've been asking. Okay, that's ridiculous. Oh, okay, they're answering to each other. Thank you for the information. Good to hear. Trying to answer any questions. I wonder if you have factor your higher risk. If you're at a higher risk for clotting altogether and then you get this disease, please be careful. I have people with high blood pressure who are really concerned. Like I said, that lady at work, she was off work for 38 days, and they were doing everything they could not to test her. And she is going to go get tested to make sure that, you know, she has it on record that she was COVID positive, because 38 days, that's about right. That's about right, because it takes like 10 to 14 days to even show symptoms. If you wind up on my ventilator, it's usually there about 2 weeks. About the third week is when we can start liberating you. So already there, we're into 4.5 weeks of infection and symptoms. And then when you get off the vent, when you lay in that bed, your body becomes lazy. So does that diaphragm. It is a muscle. If I am breathing for you, that diaphragm becomes lazy. You have to retrain your body to breathe on its own again, and it's stressful. So you lose a lot of muscle strength, and going on a vent is not good. Working from home is the best thing that we can do right now, if it's possible. I really hope employers in the future, during cold and flu season, if they have a sick employee, they have you work from home, because this is entirely possible. Telehealth medicine is entirely possible. You don't need to go to the damn hospital if you're sick. We don't want you there, because you're already going to spread more sick germs. That's why we have you put a mask on when you get to the hospital, to keep it from spreading. But you have people with pre-existing conditions who are more susceptible to picking up more crap. If you want to get sick, go to a hospital. I'm serious. This stuff spreads everywhere. I don't know how they're not going to have to sanitize the whole hospital once this COVID crisis is over, because it is everywhere. I'm in multiple layers of PPE. I'm changing things all night long. I'm washing my hands every time I touch any of it. I'm changing my gloves every time I do a different task in the room and washing my hands. And trying to get your wet hands into another pair of gloves is like trying to squeeze yourself into a freaking thigh-high compression stocking. Thoughts on aspirin therapy? I don't really know on that. We do the heparin therapy in the hospital on the heparin drips. I don't know about aspirin. I would definitely talk to your healthcare provider on that one. I haven't read anything about it. This kind of blew up on me. I was not expecting the reaction I got to the video. So I've been working like the past several days. I have today off, and then I flop over from night shift to day shift all week long. So that's going to be fun. So I haven't even had a chance to catch up on the MedCram videos. There's like a 2-hour lecture that I want to watch. There's a lot of information. So definitely talk to your healthcare provider on that one. If you are already, on aspirin therapy, and, I can't say it's a bad thing. I don't want to tell people to go out and take aspirin who shouldn't be taking it, because they have other conditions that it could conflict with. So I don't want to give out that kind of advice. Nothing. I heard something about high altitude. It's very similar to the high altitude sickness, and we were trying to treat it that way at first. But because we found it's an oxidative stress issue, we need to approach it differently. That's why it's not responding to the high altitude sickness. It was very similar. It was also very similar to ARDS, acute respiratory distress syndrome. That's why we did early intubation and high peak pressures. We found that that's not helping. We're doing more damage than anything with that. So we have been trying everything that we know conventionally, and that's why it's not working, and that's why this is not the flu. If it was the flu, these conventional methods would be working. Yeah, I don't know why China wouldn't want to help or why they would hide anything other than, hey, we were doing something we shouldn't have been doing with this. I'm really curious as to the investigations that are going to come out. What I really found interesting was on the Business Insider website, there was an article about a month ago about the first lady to contract it, took it home to her husband, and it had a timeline of events, and that article's gone off the website, and I can't find it anywhere on a Google search because I was trying to go back to that to reference it, and it's gone. So there's something shady going on here. It's my personal belief, but people can do what they want with it. Like I said, listed was high blood pressure. How is that connected to higher risk with COVID? I don't know. Anybody who has a pre-existing condition and any immunocompromised or any healthcare problems, you're going to be at risk for contracting anything. What I don't want with people with high blood pressure is to get this because of the thickening of the blood. You already have high blood pressure. If you have thickening blood, it's going to increase your blood pressure further, which puts you at higher risk for stroke. I don't need you having an aneurysm. People, I know, I wish they would educate on 5G. I get so tired of reading about that. Big issue with summer homes in northern Michigan. There aren't. I used to work at Hurley and Flint. That's where I started my career, and I have to thank every damn person who worked there that I worked with, my respiratory staff. They're the ones who trained me, and I have a lot of respect from the doctors and the nurses at the facility that I'm at because of the level of care that I give, and I learned that from the therapists that trained me, and they trained me well. I used to do the ER. They knew when I came into work, Misty wants the ER. I was living in the trauma bay. But that's where I got the experience to deal with these traumas and these ventilation modes. And some people are inexperienced. A lot of these doctors have no freaking clue what they're doing with the ventilator, and they need to let the respiratory therapist do their job. That's what we're specialized in. Ask us. Let us know what your goals are, and we'll make it work on the ventilator. Please. We didn't spend all these years in school focusing on lung ventilation strategies for you to tell us that we don't know what the hell we're doing. But yeah, there is no hospitals up there. We were pretty much the only level 1 trauma center. We used to get people airlifted from Tree Stand Falls from up in northern Michigan because there's nothing up there. The whole Upper Peninsula, I don't think there's a big hospital up there. You get to Wisconsin or you fly down to one of the other trauma centers. There's nothing up there. So if you bring the COVID, or we call it the Rona, if you bring the Rona to another community that doesn't have the ability to handle an influx of people who are sick, then we're left to, who do we ventilate? What do we do with you? I can't stand there and bag you because we're supposed to be doing what's called rapid sequence intubations, which is we don't bag you, we just hyperoxygenate you with a non-rebreather mask, which is the one that you see on all the medical shows that never has the bag inflated. That's how you know it's fake. The bag should be inflated because that's your oxygen reservoir. But we hyperoxygenate you with that, and we don't bag. We put you on the tube, and we put you on closed circuit ventilation, so we're not spreading this everywhere. So I can't stand there and bag you until we find a ventilator. So we need to have the healthcare staff to take care of you, and if you don't social distance, and you're spreading this all over the state, then you're not going to have the care that you need when you need it. So don't do that. Yeah, there's a lot of false negatives. We even see this with the flu test, though. On the rapid test, they'll be testing negative, and when we get the blood test back, they're positive. So these rapid tests, I would rather have a blood test done than anything. If you can get blood tested for definite, go do that. These rapid tests are the ones. There was a respiratory meme that, we sent the pregnancy tests out, which at the rate that these are all false negatives, dear God, I wonder how many have tested negative that are actually positive. The inaccurate testing, it needs to stop. I'm trying to scroll back. It's not letting me go back in the comments. Yeah, your uncle needs to use the machine. If the doctor has told you to use the machine, unless you've been told otherwise, use your CPAP. Just use it responsibly. Have your spouse sleep in another room. You sleep on the couch or something. And Lysol the hell out of the room when you wake up. Because if it landed on anything and you have a humidifier, kill the droplets. Vinegar and water sprays are great. We used to use vinegar and water all the time. So sick starting January 10th like never before. Yeah. Another thing that we're seeing, because it's an endothelial thing, is one of my friends is a respiratory therapist at Hurley. Her son was really sick, and he had these weird sores or something on the end of his fingers. And we're seeing that on the toes too. So that's a very, if it's an oxidative stress issue and it's attacking the blood vessels, you are definitely going to see things like that. But if you were really, if there was an unexplainable sickness back in January sometime, and the flu was negative, strep was negative, and all these other things were negative, COVID's a really good possibility. Antibody testing. Get the antibody test. See if that antibody is in the bloodstream. It sounds like poison, seeing the signs. Yeah, there are. It's not skin burns. It's coming from the inside. It's because it's affecting the blood vessels. And they are seeing issues with pink eye, but the blood vessels, again, they're all in the eye, and it's actually not pink eye. I think it was the therapist that I just referred to, her son. I think she was told that either he had pink eye and it wasn't actually pink eye, or it was her. It was somebody that they knew or something in that group, but it's not pink eye. It's infection, or it's an inflammation of the blood vessels, which is mimicking these symptoms. So yeah, have you seen any asthmatics? I haven't seen anything. No, most of these people are healthy, or they're elderly with a million different conditions. It's either or, but the worst ones that I am seeing are the ones with a healthy immune system, because that inflammatory response is even greater in people with healthy immune systems, because it's ramping up trying to fight this virus, and there's more inflammation happening. That cytokine storm is just insane. When I open up the lab results, everything is like bright red in major critical values because of the release of these inflammatory markers. You'll have to Google the cytokine storm. It's kind of an in-depth thing, and it's something that the body does when there's an immune response. That's the best way that I can describe it. For some reason, I can't scroll back on these comments. I'm sorry, guys. I was able to scroll, and now it's not letting me. Work at a hospital, I was negative, and they were putting us back to work. At least they're testing you. The hospital I was at down in Texas, we had to stand 6 feet apart and get our temperature taken, answer a bunch of questions, even get in the door. This hospital, they're just like, put a mask on. I'm taking my own temperature before I go in. Anybody have another disease where their blood breathing seems to be more vulnerable? Z-Dog, MD, Shelly. He's a doctor. He's really great. You'll have to go check out his YouTube and his Facebook. It's ZDOG. Oh my God, I can't even spell. ZDOGGMD. My brain is so fried right now with COVID. This must cross the blood. Yes, it does cross the blood-brain barrier. We are seeing a lot of abnormal brain activity with this. Things that you normally wouldn't see with the flu. This is not the flu. Neurological, a lot of it's in the breathing disorders. It's affecting the respiratory center on my end. That's what I'm seeing. When they get to the floor, there's other things happening, but I don't really work with a lot of floor patients. I work with a lot of the respiratory patients, and they're having to like really sedate these people. They're on 4 different sedatives. Sometimes they're on a paralytic to get them to cooperate with the ventilator so they can get the blood gases to normalize the way that they want them to, because they're completely fighting any ventilation strategy, which I don't even know if that's the best idea. If the body wants to do that and it's not being affected too much with my ventilator and the blood gas results, let them be. Because when you're fighting the ventilator, we have to sedate you more, and then we're impairing your ability to breathe and cough. And I need you to breathe and cough. I need you off my vent. I don't want you on it. The longer you're on it, the longer it's going to take to liberate you. And the higher, once you get on a vent, you're at higher risk of acquiring a ventilator-acquired pneumonia. So not only do you have the pneumonia that comes with COVID, now you get VAP. And we have VAP protocols, but when you're on positive pressure ventilation, it needs to be for very short term. Let me see if I can open this up on my other Facebook page just so I can see the damn comments. It's really upsetting me. Yeah, they're going to have some COVID survivors. They're seeing lung damage, like they're young, and when they get done, their lung function is that of somebody with this, like a 70-year-old. It is really insane. And the, geez, oh, Pete, everything's got a lag. But yeah, there is long-term lung damage. When you have oxygen deprivation, I'm going to open up the live video and not turn the sound on the computer so I can kind of see the comments. You are going to have long-term side effects of this. I mean, it's going to take a long time to recover from COVID completely for these people. The Walmart shooting victims in El Paso, we just lost another one. It happened in August, and he just passed away from the complications that happened from that shooting. Let's see here. Oh, I can scroll. Yay. Let's see here. I'm going to go back. How high are you seeing? I had a peak pressure on a guy last night of 18. And I was screaming at the doctor because all of a sudden at 6:30 he desatted, and there's a leak in my ventilation and I'm losing my volumes, and we all know where that's going. And they wanted to move the tube, and I'm like, I don't think so. You need to look for a pneumothorax. So we're pushing all these high pressures into a stiff lung. And what I am seeing is that a lot of the pulmonary fellows are turning the PEEP down. They're not going with the high PEEP pressures anymore. Gosh, I'm trying to go. How long before antibodies show up in the blood? That I don't know. I would imagine as soon as you test positive. Contagious for, God, that's a good question. Since we don't know much about this virus, which is one of the big things, it's if you test positive, some people are being reinfected. So we don't know. We really don't. That's why we need patience and research. YouTube Junkie. Yeah, he's on YouTube and Facebook. He is awesome. I really like interacting with him through Facebook a little bit better, though. It's just, and that's the thing. I'm kind of learning about both of these platforms from ZDog because he's kind of testing out YouTube and Facebook to see what the responses are. So I'm going to try and do the same thing. Sounds so suspicious. Have you seen the Australian Prime Minister's wanting investigation? Oh, absolutely. I seen that, and the trade sanctions, I totally agree with. They need to be sanctioned right down. Everybody needs to do it, and they need to quit ordering off Wish, quit wanting cheap shit from China, because all you're doing is helping them out with their economy, and we don't need to be doing that. The American people need American jobs. So after all this, it's pro-America time, guys. So highly contagious. Why aren't people, for instance, here in Southern Illinois? No one has been wearing a mask since the beginning of this. Walmart's, gas stations, Lowe's. That's a good question. How many positive cases do you guys have, though? I mean, if you have infected people out in the community, they are spreading it. So, do you have a lot of open land in your area? I mean, are people on top of each other like here in New York and New Jersey, or are they spread out? South Dakota is pretty spread out. Wyoming is spread out. You drive through Wyoming, you can camp anywhere that isn't labeled don't camp because it's wide open spaces. Intubation is I don't feel that intubation is the best for COVID, Cindy. I think we need to do everything we can to keep people off of it, and we need to quit fearing what we're doing. If we put the HEPA filters on our BiPAP, it has been shown to contain the majority of the aerosolization of that virus. The high flow nasal cannula, it already puts out a very minimal aerosolization because it's blowing right down the nasal passages to the airway. So if you put a surgical mask over the patient with a high flow, we can keep people off of these ventilators. We were told in the very beginning early intubation was best, and now we're finding that early intubation is not the answer. So no, I don't want to intubate you unless I have to. It breaks my heart when I do it because it's my biggest fear that they're not coming off. Honestly, Shonda, they're not using BiPAP or high flow because they're scared. We were told not to use it in the beginning, and now we're being told it is okay. Research is what matters. And I don't know who the hell's knocking on my door. I don't know anybody here. That's weird. But education is important when it comes to the BiPAP and the high flow, because there are safe ways to use those methods, and we do need to use them. If the patient is going to benefit from it, then we need to put them on it if it's going to prevent intubation. Is there a lot of pain with this? Some people experience chest tightness from all that mucus that they're trying to cough out, almost like feeling like bronchitis. They do complain of chest pain. Some do not. Like I said, everybody comes in with a different set of complaints. But when you look at the blood work and what's going on in the body, all that is the same. Are you proning most? We're trying to prone them, Fatima, but some people we can't because they desat so bad that it's going to affect the oxygenation more. What I don't have at my facility are the proning beds. In El Paso, we do have some. Here we have none. And it's funny because I usually work for a nonprofit or a public health system, and they always say, oh, your ideas are so wonderful, but we can't afford it. But the other nonprofit and a place, I'm usually in the hood. I mean, I like working with that population of patients. They're the ones that need me the most. And when I can save a life like that, they are very appreciative, and that's the population that I choose to serve. But we don't have the availability of those things, and I wish we did. But if they are on the floors, they are proning them. They're on like a 6-hour schedule, and I've seen them very comfortably proned on the high flow and staying off my ventilator. Currently asymptomatic people seem to be contagious. Okay, thank you for answering that question. Anybody who can pitch in is great. Okay, here's the thing with vitamin C, Gerson. If you look at where the original study came from, it was done in the military with soldiers who experienced a traumatic, like, limb loss or something like that. So in a situation under extreme stress, which oxidative stress would probably, don't quote me as fact, be considered a situation where that may help. We give it through IV in the hospital. What we give through an IV is not the same dose. Please do not clear off the shelves of vitamin C at the Rite Aid. I've seen that, and I'm just like, oh God, here we go. So in cold and flu season, vitamin C overall is probably not going to help you. If your body is under extreme stress, like my patients on the ventilator, yes, it may help. But if you go look at the study, it was done in the military under extreme stress, and they did find that it could possibly benefit. So in some way possible, yes. I've not really seen it added to my patient's treatment regimen in the chart, but that doesn't mean they might not be trying that in a different hospital. Thank you for giving us your time. I enjoy doing it. I enjoy educating. I enjoy answering questions. I don't like having to yell at people and telling them that this is not the fucking flu. But I will if I have to. It's just very frustrating because people are negative, and this is not a time to be negative. Yeah, working in a nursing home right now, our nursing home nurses, I mean, y'all donate masks to them. If you have surgical masks and N95 sitting at home and you got a cloth mask that you can wear in public to contain this stuff, please donate them to your nursing home nurses because they have nothing. They're being asked to use the same N95 all week, and that's not okay. That's not okay at all. That's bad, because if there is COVID on the outside of that mask, it's being laid out, it's being touched, it's there, it's going to spread, and these nurses are scared to death, and it's going to affect the residents of the nursing home as well, because it's going to contribute to the spread. So please, please, please donate any of that. Zinc, there's been no findings of any of that. I don't take anything. I don't even eat properly because I work in the medical field and I kind of eat on the run, and I live on coffee and caffeine. So I don't take anything. I wear my PPE and I wash my hands. I get my flu shot every year and I'm not getting sick. But I don't know how many positive cases are in Port Huron. I know I did get asked to take a travel assignment in Michigan, and just because I wanted to travel, I didn't really want to go home. But they wanted me to go to the convention center that didn't have any ventilators, and I do ventilators for a living. I don't just stare at people and watch them breathe, except for in the window when my vent isn't acting right, like all morning long. Maybe get lucky. No, sick will come in there. Yeah, I really hope that people don't This is terrible. Are you giving chest tubes in advance? Well, only reason that we would give a chest tube, I don't, Sarah, I might need clarification. Are you talking about like the endotracheal tube? Because a chest tube is what goes in the side of your chest if you have a pneumothorax. Um, I really hope that people don't need chest tubes or ET tubes with this COVID. I mean, the number of intubations and the I really think that maybe we could have prevented some of these intubations in the beginning if we weren't told to intubate early. Definitely watched him too. What she is saying personally. Shoot, I watched him too. I'm not sure who you were watching. I missed the comment. I'm believing someone actively suctioning lungs versus a doc. Yeah, I'm going to tell you what, the doctors that I had on staff last night do not know what they're doing with the ventilator. They're standing there at the window and I'm yelling, this is a pneumothorax. This has got every indication of low oxygen levels and a leak, and you're just like, move the tube. It's not a problem with the endotracheal tube. So they are throwing doctors on the front lines who do not have experience running ventilators, and they need to let us do our jobs and listen to us because we're not ignorant. And other organs, it's going... Because this is a vessel disease, it is putting stress on these organs, and you can go into multiple system organ failure. And when you have organ failure, it's going to affect other areas of your body. I mean, if you don't have, we are seeing renal failure, so your kidneys aren't outputting anything. The resdemifir, we are seeing kidney failure with that. Now, whether or not if we would have started that sooner before these patients got really sick, who knows? But is reinfection just that? I don't know. I haven't had any personal reinfection patients, so I can't answer that. Dad, I didn't call back because I got really busy with this. I love you, but I'm trying to do this and help people. That's the same for all patients. We're seeing the inflammatory markers elevated, clotting issues, the hypercoagulation issues, hypoxemia, the low PaO2s. We're seeing all of that in all of these people. I wish we had more rotoprone beds. Those things are a freaking godsend in heaven. Yeah, the doctors are and the scientists are trying to throw everything at this right now. I mean, it is so hard. If you're coughing up phlegm. See, here's the thing with phlegm in the flu. The flu doesn't have phlegm. A lot of people are really dry with the flu. I was like moistening my patients' mouths who had the flu because they were like dry and cracked. Let's see here. Why are they? They're putting so many nurses on furlough because they are not doing surgeries right now. They're just getting back to elective surgeries. They were trying to contain the spread of this, and people coming in sick to a hospital and spreading this is not what we needed. Docs and immunology, epidemiology, yeah, we do need to be out in the fresh air. I mean, we do, if we can get out into the parks and open those things first and let people just get the hell out of the house. But look at California and the beaches. They ruined it for everybody. Stay the hell away from each other and don't do that. Please follow the social distancing guidelines and just stay away from each other. We do need fresh air. We cannot be cooped up in the house. If somebody is sick and we are cooped up in the house with them, we have the potential to get sick. So we don't need to be, and then you're going to quarantine yourself in your own house so you're staring at four walls in a hotel room like I'm doing. So yes, it is important to do that, but we have to do it responsibly. That's the thing. We need to be responsible. Standing on the Capitol steps and screaming in police officers' faces and spreading droplets is not responsible. The blood vessels in the eye. You have mucous membranes, and you also have blood vessels in your eyes. So, like, you can hemorrhage from coughing too hard. I mean, when I used to have my gastrointestinal issues when I dealt with my husband's PTSD and the stress, I would vomit so hard I would blow the blood vessels out around my eyes. But you have the blood vessels in your eyes too. And this disease is attacking the lining of the blood vessels. So they're going to be inflamed and irritated. So it's going to mimic things of the pink eye. Go to MedCram on YouTube, MEDCRAM, and you'll see where it says COVID-19, is this a disease of the blood vessels? and it's causing oxidative stress, and it's causing the endothelium to pretty much die. So that's what's going on. Does blood type make a difference? I haven't seen anything about blood type making a difference. Hi, guys. Oh my gosh, there's like 62 new comments. I'm trying to go through these. You guys are great. Once they're on the vent. Yeah, it's hard to wean them off. The second residents are writing orders. Yeah, we need more attendings. Get your ass out of the bed and come into the... Get here and help us, because these residents do not know what they're doing. I don't know where they're getting their education and what they've been taught, but it is very outdated. Listen to your respiratory therapist. They are the ones who do this for a living. Please let us do our jobs. You can message me privately. Absolutely. I've been responding to every single private message. People are getting reinfected or are relapsing. It's possible. I don't know if it's just because they're having a hard time from the very beginning and their body is just so weak. We're still learning so much. Send the nurses to the nursing. Yeah, send the furlough nurses to the nursing home. I love that idea. They could really use some help. And that way you could keep the nurses in one area instead of having to run all over the damn nursing home to take care of too many patients and not have enough help. So there are jobs out there. I'm going to tell you that right now. The doctor she was talking about was saying masks don't work, don't wear them, get out and build up. Yeah, herd immunity is not always... There is so much to immunity, folks. It's not just one thing. Herd immunity... I'm going to have to do a topic on this, and I'm going to have to figure out... When I'm at work and I'm working with my patients, I formulate things that I do want to talk about, and I write it down. So I think I'm going to do a conversation about that, because people really need to understand what immunity actually is and what it does and how it works and how it doesn't work. So there's a lot of misinformation out there, and those doctors out in California, while they did have a good point, they went about it in the wrong way. Z-Dog has a great video about the clowns out in California. Those are the Bakerfields, Doc, and they took them down for... Yeah, I'm not really... President Trump, I agree with how he's handling our situation, but he is not the best public speaker. Not the best at all. When he referred to that woman in Michigan, I think it was because he didn't know her name and he was just trying to, on the fly, explain something. And once again, he put his foot in his mouth. People went off on that and they were like, oh, he's against this, he's against that. What he wants is the state governors to handle their shit. Let them handle their shit. But the ones that are overstepping their bounds, there are some states that are extending things till June 30th, and they're getting really ridiculous with their restrictions. That is something to protest, okay? Protesting the fact that we want you to stay at home a little while longer while we get this under control in our states is a little bit different. So not everyone is going to have to react, not even in the same cities. There are different cities within states that are not affected. So roll them out differently. But President Trump, I honestly think sometimes he should have somebody speak for him, because he is not the best informative. Just like the disinfectant thing. We do disinfect the lungs. An antibiotic is a disinfectant. I inject things down into endotracheal tubes all the time, like lidocaine. We put it in directly when we're doing procedures. He was asking a question to the doctor, and maybe they should have talked about that before the press conference, and maybe let the doctor bring that up. But probably not the best way to go about that. He does need to step in, I think, right now and make a statement about this ignorance in Michigan and that he doesn't support this. I think he's like waiting to see what happens, and he's trying not to inflame anything else, but we're not in that man's shoes and we don't know. So we have to have a little bit of respect, because this man has gotten a lot done in a very short period of time. Our economy was very strong before this. We are going to bounce back, and there are people with really innovative ideas, making money, making an income. It is possible. It is possible. Where there is a will, there is a way. This is freaking America, and this is why people come here. I have Hispanic people stop me all the time to like root on my Trump sticker on the back of my car. I mean, they just about stop traffic and cause car accidents, which in El Paso, I don't want any more car accidents. Um, but they're coming over from Mexico. They have businesses here in America. They're paying taxes, and they're able to support their families back home. So they do support our president. So there's a lot of misinformation there as well. And I really need people to educate themselves. Please just don't make assumptions. Just, and we have a big problem with people climbing over the border fence down in El Paso. A lot of my hospital rooms in El Paso have Border Patrol agents outside because they are illegals who fell over the fence or drowned in a sewer pipe, because we don't have sewer systems in El Paso. We have these big drain pipes, and when we have flash floods, people are in those sewer pipes hiding, and they can't swim. And it's sad. It really is. But we do need to control that. We need better PPE protocol, period. Hospital workers, the reason we have hospital-acquired health infection is because hospital workers are the ones transmitting these bacteria back and forth to patients because they're not washing their damn hands. They're not taking the proper precautions. And sometimes it's because we don't have the PPE, but other times it's because they're just lazy. Some of them are just there for a paycheck. So wash your hands. And it's perfectly acceptable when you have a healthcare worker come into your room that you ask them to wash their hands. I don't care if they wash them out in the hall. Ask them to wash their hands again. We have posters on the wall asking y'all to do that. So please encourage them. Advocate for yourselves. We encourage our patients to advocate for themselves because you are no better advocate. I am out here doing what my patients can't do because they can't talk. Marissa, I don't know about treatments and vaccines right now. They're pushing the Resdemivir, but it's not a cure. It's not like the antiviral that we have with the flu to where that it's going to stop the symptoms, and it's only working in so many patients, and we're not seeing any results in the really critical ones. Once they get to me, they're usually too far gone. Vaccines, I wouldn't touch a vaccine for at least 5 years. We need freaking research, and research takes time. I don't know if there will be a second wave in the fall. If this doesn't go away and people don't follow guidelines of washing your hands and staying home when you're sick, I mean, obviously we're going to have the typical flu, but the corona, I don't know. And people need to understand that the coronavirus causes the common cold. This is a mutation of a family of viruses. So the coronavirus that you're reading on the back of the Lysol can is the common cold virus. The coronavirus that we have now, we don't have the research to know if Lysol kills it. We can assume it does because it kills the rest of the family viruses, but Lysol doesn't have the virus to test to make sure that it kills it. So the best thing we can do, the single best thing that you can do is hand washing. My husband has severe asthma. Yeah, I am very afraid of any of my asthmatic patients getting it because we can't nebulize medications. And if we do, it's really unsafe for us. It's putting us at risk. And we have 2 negative pressure rooms at the hospital that I'm at. 2. And there's a few portable units to help exchange the air. But the rest of it, it's just floating around the room and we're all up in it. So it's really important to wash our hands. Healthcare workers, wash your hands, because I have seen bacteria spread from patient to patient that are uncommon, and the only way that they could have gotten there is by healthcare workers not washing their hands. Sometimes it doesn't go away, it just goes dormant. Yeah, and that's the thing, since we don't have research on this damn virus, that's why all these rules are in place, and we're being so aggressive with it, because we do need that upfront aggression. Now, we don't need people locked in their homes like China did. I mean, they were going door to door in China and making people stay at home and testing them, and they weren't even allowed out in the streets. They were out there chasing them with a bullhorn and with drones. Okay, it's already creepy enough going to the airport and hearing the mechanical voice. It's like being in Total Recall or something. Let's not have to do this. I mean, when there's a national state of emergency declared, it's because I got to check my phone battery here. Hang on, guys. 39%. Let me grab my charger real quick just so I can put this on. I should be okay. It's an extended battery, but we don't know. research takes time. God, does it take time? What we have done so far is simply amazing. This man has moved mountains to get this stuff done. You can call Governor Whitner all you want, all the names, but what she's doing is the right thing. She locked it down to contain this, and we need to slowly reopen in the areas that are safe, and we need to see what happens. Our hospitals are overwhelmed. We do not have the resources. That's why there is a giant convention center with a military hospital that's run by the federal government right now, because we don't have the resources in Michigan. Don't do that to your state. Don't do it. Drop the attitude. She's not the Wicked Witch. I mean, I know she can present herself that way. We all have ways of presenting ourselves, but you don't know what she's going through. You do not know the stress that that woman is facing and what the shit she is eating right now from these people. I mean, who shows up to the Capitol steps with a freaking rifle? This is not a Second Amendment issue. Hospital reports so packed. Some of them are packed and some of them are not, Carrie. It just all depends on the hospital. Why? I don't know. A lot of them are surgical hospitals. They're not hospitals that are equipped with intensive care units. A lot of them do same-day surgeries, and then the people go home, and they're only there to recover. So they might not have the resources at that facility to handle the COVID patients. That's what I am seeing with a lot of these. But our hospital is packed to the gills. It's kind of tapering off right now, but the state's slowly starting to reopen, so we're kind of scared. Yeah, don't get a vaccine. Again, the vaccine, 5 years. Trump did not endorse the white supremacists carrying the guns and spitting on the policemen's faces. That was not what he said. It was taken out of context. Once again, just like the disinfectant. I'm not going to get into political statements. I did research all of this before I got on here, and that's not what he said. And Trump has actually brought sanctions against white supremacist groups since he's been in office. So I suggest you Google that and see where he stands on hate groups. Okay? It's not what people are making it out to be. I am the state of New Mexico. I don't really know. I wish I was back in El Paso right now to see what's really going on, but I do know that El Paso is kind of raising the red flag on their cases right now because they are going up. In New Mexico, I'm 13 miles away. They shut that town down in Gallup, which was a good idea because, like I said, in the Hispanic culture, people live very tightly packed together. The extended family all lives together, and it's going to spread like crazy. So if there's a high case incidence there, it's a good idea. And there's not a lot of, there's a lot of land out there, and there's not a lot of big cities. So people do live in congested areas in these larger cities. But I have talked to somebody who lives out on the reservation out there that's affected because they need to go there to get food. And they can't find anything. So that's a problem. We need to be able to get people food and water. Really gifted people don't have great social skills because we don't have the goddamn patience to deal with some of the stupidity that we see. I read a lot. I've always read. My mother had me reading before kindergarten. I don't watch TV. I am not entertained by it. I try to research all that I can. I try to read and be informed and make sure that I'm reading the proper information. And I try to share what I learn with other people. But there are times where this whole social distancing thing, this is my life every day. I socially distance from people. I do arts and crafts at home, and I sell them to help support PTSD awareness. And you can see that on my Journey of a Combat Veteran spouse page. That's what I dedicate my time to, because I would rather help people, but I do it from my home, and I socialize very minimally. If I want to socialize, I go drive Uber. Yeah, good. No, you're not being overcautious, Kara. If you have especially respiratory conditions, because this does attack the respiratory system, it is a good idea to stay home. Wondering if she's heard anything from the medical staff where she's working. What do you mean by what I've heard from the medical staff? Are you talking to me or responding to somebody else? I think he was misinformed. There was a few different groups of people there. There were good people who were there, and then there were hate groups. And I think the good people got lumped in with the hate groups. The hate group is the one that organized it, but other people who did have valid concerns who were not affiliated with that group were there. And that's, I believe, who he was referring to. They did not have their masks on, and so did the other people who showed up did not have masks on, and they were not socially distancing either. The pictures that got presented were just the ones of the hate. So a picture is just a snapshot in time. Unless you were there and had the entire video experience and the whole personal experience, you cannot go off of one picture as to what really happened. And you need to remember that. A picture can be, look at memes. Memes are a great example. They can be manipulated any way you want. I need you to go to Detroit. My dad's... I'm so sorry. I really wanted to come, but I really want the experience out here on the front lines, because New York and New Jersey are like the top, like they're the ones who are doing the research, and that's where we're getting all the best information on this at, and that's why I volunteered to come out here and help, is to get the education. Many of our states are refusing the same treatment. I don't know if the states are just refusing the ventilators just because they don't need them, because they can redirect their resources where they need them, like these hospitals that aren't seeing patients, they can share their ventilators. We usually get the ventilators that we need during cold and flu season from rental companies. So if you don't need the federal help, why take something that you don't need from somebody who might need it? That's my take on it. They were adamant on the hand washing and sanitizer. Yes, please use it properly. Please, 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 please. Sing your ABCs while you're washing your hands and scrub those fingernails. Yeah, people are not doing what they are supposed to. People are making the comments that we can make adult decisions. These are the same people who get out and drink and drive and break the law. And that's why we have the government. They need to tell us what to do sometimes because we do stupid things. Supplies making, oh my god, yeah, the shortage of supplies is a big problem. We do need a stockpile, and I do believe that once this is all over, we are going to start redirecting resources and stockpiling crap where we need it, and America comes first in this. And I'm getting, let me tell you about the Chinese N95 that I wear at work. Actually, let me pull it out. I have my work bag right here because I refuse to wear it, and I'm going to tell you why. Actually, I have both N95s here because I keep this one because it's too small. And I'm going to explain something. This is my bag of surgical masks. But, okay. Education session. This is a normal N95 mask. Do you see these straps? They go over the back of the head, and you put it on a specific way. And you are fit tested for this, so that way no air gets out or in. Okay? Special filters. So this here is an American real N95. This is what I'm getting at work. The KN95. Do you notice something here? Ear straps. You know what it doesn't do? Seal. You know where all my breath goes? Out the top and bottom. Yeah. And it smells like mesquite chips for some damn reason. So, Chinese N95, real N95. I don't need a KN95. I need one of these. You know what I don't have? One of these. My irritation is very high. Nurses doing TikTok. Okay, you know, we do need to do a little bit of stress relief, and if they're doing the little foot dance and it's not in an area with patient care and patient information, and the hospital doesn't have a problem with it, it's not violating their policy, fine. But when they're throwing a COVID dummy around, that's probably not the most intelligent thing to do. That was tactless. And, you know, we do have to have a little fun. Nurses and military have a little bit of a sick sense of humor. I mean, we have to in these hard times. It's very dark humor. And some people don't get that. And we need to be mindful of what we put on the internet when we do things like that, because it does reflect negatively upon us and our professions. And if we're having fun and trying to, you know, do something, you know, to break the monotony of death, I guess that's the only way to put it, because there's a lot of death. Fine. If it's not taking away from patient care activities, and, you know, it's just like, what was that, a Cowboy Up song where everybody kind of, like the police officers were doing a cowboy, I can't remember, I don't listen to a lot of stuff, I read. So I can't remember the name of the song or who did it, but in that case, yes. But if they're in a patient care area and they're doing things that are looking really bad upon the hospital and our profession, then I do not agree with it at all. Um, Made it for they could buy it. Thanks for being. Thank you. I'm trying. My champion cause is PTSD awareness because of my coworkers. When we get out of here, there are going to be a lot of people who are affected by this. I already champion for my veterans and the spouses because secondary PTSD, when you're living with somebody who suffers from PTSD, is a very real thing. I was suicidal. I tried to jump out of a moving vehicle at 70 miles an hour to get away from my husband just because of the evil look in his eye, because he turned on me in the blink of an eye. And that's what we deal with. And living with somebody with PTSD and stress, it's going to affect their family when they get home. So we need to be understanding of what's going on and be on the lookout for mental health problems and suicide. What is it about been calling her that for? Yes, I did see that for over a year. I understand that we don't always agree, but you guys did vote her in. And if we want to make changes, we need to be mindful of who we're voting for and quit voting along party lines. We need to actually look at where our candidates stand on their public stances, and that's who we need to vote for. We don't just need to go, I'm a Democrat, I'm voting straight ticket, because I'm right in the middle. I'm like, I have these values and these are the causes that I believe in. Who stands behind what I believe in? And that's how you need to vote. You need to make educated and informed decisions. And if you don't like who's in office, make changes come voting time. That's the way to take care of that, and talk to friends and family and encourage them to vote. People saying that I'm in the middle and I don't vote, that's a problem, because we need your vote. That's a freedom that was fought for, all those freedoms and liberties that people are bitching about, but you got the freedom to vote too. Go do it. I'm trying to stay safe. No one is following the rules, and we feel we reopen too soon. Yeah, see, this is going to be a common complaint. America's soon going to be hollering, they should have locked it down, and they should have prevented the spread of COVID before all this shit went down and went south. So, yeah, we're going to be seeing a lot of this. 1 mile from the Capitol in Lansing, and the protests were ridiculous. The first one caused problems, regardless of what the officials... Yeah, this is not going to last forever. If we just cooperate, this will go away very quickly. Just do it. That's why we're asking people to do what they're doing, is so we can contain this and get everybody back to work. They don't want the economy crippled. It doesn't make anybody look good. It doesn't make the Democrats look good. It doesn't make the Republicans look good. It doesn't make us look good. It makes us look like we can't bring our country together and come together. Just like JFK, it's like I said, ask not what your country can do for you, ask what you can do for your country. It's a public cry to do something for the greater good of the public. It's not about us. I'm in the hood. Yeah, I am in the hood. I am. And people were thinking I was crazy for walking to work. And there are homeless people all over the place out here camping, sleeping. I do stop and talk to them. I don't ignore them like they're not people. And that's why I have a lot of respect for human life, and I have a lot of empathy, because there's a reason they wound up on those streets, and I want to hear their stories. Being in Flint, Michigan, I don't know how much more hood you can get, man. We had people rolling up with being shot up and shoved out the back door of a car and dumped in the ER drive-through and taken off. Very hood. Increases in California. Yeah, California. God, you guys have so many comments. Oh my God. To thin the mucus through your lungs, Mucinex. Yeah, Mucinex is a great expectorant, and it does help to break it up. Water. Make sure you are hydrated. Mucus needs water to move out, but we do give Mucinex all over the place. So definitely Mucinex. I do support the Mucinex. Wear a mask and wash your hands. When you wear a mask, you are preventing the spread to other people, and you're protecting yourself. What I don't think is people needing to be wearing masks on a trail that has nobody on it. That's jogging. That's ignorant. We don't need that. But if, we have to tell everybody to wear a mask, and have to tell them where to wear it and where not to wear it. There's reasons for it, and it's because people can't follow damn directions. Flight attendant work group, constant battle going no. Okay, definitely reach out to me in a private message, Donna. I'll be more than happy to do that. Sarcoidosis, oh my gosh, yeah. from taking a med to control. I'm scared to death right now with this virus. I do understand why. Sarcoid is very hard to deal with. PPE does one need in order to be safe working at a home healthcare or homeless shelter? Okay, you need the same PPE I do. And I don't know how prevalent, Amanda, tuberculosis is in your area, but in El Paso, it's pretty prevalent. So the N95, I would highly recommend that you have. If not, at least the surgical mask, not the cloth mask, the surgical mask, because it's going to contain more droplets. So at least a surgical mask, but I would recommend the N95 and not the Chinese one. Obviously, eye protection, just even safety goggles, because the droplet can spread through your eye. And I'm not trying to bash homeless people, but they do not have a way to take care of their hygiene like the average American does. They can't wash their hands repeatedly. They don't have the access to hand sanitizer. So those things, I'm not judging anybody. By all means, they're some of my favorite people to work with. I love talking to them. But home health care and things like that, obviously gloves. When you change your gloves, wash your damn hands. When you switch tasks, wash your hands. I would not take the first vaccine. I would not take a vaccine for several years until it's researched. I want to know what the side effects are. I want to see research behind it. I'm not just going to take something because, somebody said to. If this is brand new and we don't know anything about this virus, how do I know that that vaccine is safe? I'm not going, I want to see research behind it. And I would expect anybody. Now, the risks that we have with the flu vaccine, they're known. And we do have reactions. Anything that you put in your body that is not normal can cause a reaction. Sorry. Okay, I'm doing good on the battery. We need research. But we have research on the flu. But anything that you put that can alter, you can have a reaction to alcohol. You can have a reaction to a psychedelic drug. You can have a reaction to a bee sting. You can be stung by a bee 1,000,000 times, and then the 1,000,001, you can have a reaction. So there's always that risk, but you have to do a risk analysis. And it's not like how many people can we deal with who die from this? No. It's, does the risk outweigh the benefit, or does the benefit outweigh the risk? And you have to make a personal choice on that. My personal choice would be, I'm going to wait for a vaccine and I'm going to wash my hands and wear a mask. That's what I'll do to protect myself. It's working so far, and I'm going to stick with what I know. Except the app is on many law enforcement lists. Who owns it? I don't even know what they're talking about. What happened to the United States stockpiles? I don't know. I don't know if FEMA depleted them or what the hell's going on, but I guarantee you we need to find out. And that's something that we need to demand of our lawmakers that we're electing, is that that's on something on their agenda. And we need to start electing people who aren't career politicians. You need to elect the smart people who don't have time for the negativity and the hate, who do want to make a change. Those are the people. And the ones who aren't putting on negative political ads. If you're putting any kind of negativity, I don't care what group you're in on the TV, I don't even want to hear from you, because everything negative that you say just blocked out anything positive that you could be doing for me. I don't want to hear it. No PPE for some of these doctors and nurses do not have it, and these nurses are being told go to work or get fired. HCA facilities are having nurses who test positive sign non-disclosure agreements that they won't talk about it and make them look bad. So we need to make some changes in healthcare. Oh, thank you so much, Marissa. I'll shoot you a message. I really appreciate that, because I really need one, because I'm not wearing these Chinese N95s, and it's really nerve-wracking. I mean, I go into the nursing office and demand a different one, but they're these duckbill ones, and they fit okay, but the one I had last night was lined with plastic, and it was breaking out my face. I'm like, what even is this? I had to order my own goggles because I can't even see through the face shield. It fogs up because these masks leak, and I have condensation all over the face shield. Every vote does count, Chrissy. You are very, 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 very correct. We need to stop dividing this country along party lines. Everybody has values, but being a Democrat or a Republican or an independent, it doesn't define who you are, and you don't need to be labeled into a group. Oh, thanks, Caroline. Carol, I'm actually in a free room for frontline workers. The Hilton here has put us up for free until the end of May, which is fantastic because this is a great hotel here at Penn Station. I do appreciate it. They are awesome here. And Delta flew me out here for free. So that is awesome. Let's see. I'm trying to, there's 119 comments. Oh my God, you guys, you are awesome. Try being shot up in the Detroit ER room. Shonda, when I worked at Hurley, we didn't have any metal detectors or anything, and that was a problem. That's exactly what was happening as people were coming in to finish off what they started. So when they built the new trauma bay, they did put metal detectors in the entrance to the ER. So I do know what you're experiencing. There has been many times it's been on lockdown. There is a police station area in Hurley. At least there was when I worked there. I have been through that. I do know. And I have mad respect for my inner city hospital workers because I do know what you're going through. I very much do. St. Louis is, St. Louis was, when I worked at Hurley, we were homicide capital 2 years in a row in Flint. St. Louis was the next one. And then Chicago, I believe. Homeless people in the hospital. Yes, I do. I do see a lot of homeless in the hospital with COVID. I really do. I've had some people die alone, and I held their hand, and I'm not going to let any of my patients die alone. Yeah, definitely wait on the vaccine. There's a lot of vaccine questions. No, you don't need to feel guilty for continuing asking questions and comments. I will answer them as best I can with the best information that I have. I try to be accurate. If I don't, I will let you know. I'm glad the hate messages have stopped, however, because I can't deal with the negativity and all the people ranting. Oh crap, what am I doing? I have a touch screen tablet that's lagging, so I'm just over here trying to scroll through comments. They fired a girl in Fenton nursing home because her doctor said to stay home. Her husband was positive. My mom's. These need to be documented because these are going to be lawsuits. It's going to take a while, and people do have to keep up the fight. This is another thing. After all this is over, the healthcare workers, the little guy, everybody who's been affected, we still need to keep up the fight. We cannot go back to the norm of putting up with this crap. You do have to stand up for yourselves. If you are being neglected at work, you don't have the supplies that you need, don't stay quiet. Don't continue to stay quiet. You need to speak up, and we need to continue to speak up because the minute somebody starts to put a little bit of pressure on us, we back down, and that's the problem. And that's where the union representatives are great, but we need to unite as a population, not just have unions. We need to unite together and stand up and vote for the right people and stand up for what we believe in, which are basic human rights of, hey, if I'm going to be fighting this disease, I need my supplies and I need food and water. Yes, we do. There are ways to get it. It's not screaming in somebody's face. That's not going to, if you do negative things, that's what you're going to get is a negative response because nobody wants to deal with you. Nobody. If you are trying to be positive, just like when my husband and I separated, I had some issues with the bank. I called them. They were very helpful. Amazon, I was missing a part to my son's mini bike and the manufacturer warranty wore out or ran out before he put it together and realized that the part was missing. And Amazon refunded 25% of my money that I paid because the manufacturer treated me like crap, Coleman. So if you are positive and you are treating people with human decency and respect, that's what you're going to get in return. Screaming on those Capitol steps is not going to get you anything but negative press. It's not getting you the attention that you need. You're not doing it in the right way. That's why it's peaceful protesting. Peaceful things make a huge impact and a huge statement. Are you in favor of getting the annual flu shot? I am. I do get my flu shot. I get it every year faithfully, and sometimes we get 2. In Michigan, I used to get 2. I used to get a booster in February. I do get them. I have personally not been sick for 10 years, and I'm going to continue to get my flu shot. Thankful that it failed to fit it. Actually, yeah, see, the Papper hood, see, it's great for some people, but for me, I need my stethoscope in my ears, and I can't hear with the Papper running, and I can't get my stethoscope in my ears with the Papper on. So I prefer the N95 because it also doesn't fog up my glasses. Appreciate your honesty. Yeah, see, people need to, they used to make fun of people who wore the masks in public. Oh my God, there's 145 new comments. With the masks for leukemia and cancer patients because they're protecting themselves from getting other people's infections because their bodies have no immunity to fight anything back. And there's like a social, why would you make fun of somebody? I don't even understand the hate, and that's not even something to make. I've been cyberbullied by my husband's friend who's got like 19 stalker profiles, and she's been like stalking me on Facebook for 2 years. And there's plenty of evidence now, and I'm going to be taking this to court because I am going to stand up for what's right. And cyberbullying is not okay, and neither is bullying anybody in public. Why the freaking hell would you make fun of somebody for something like that? Don't be an asshole. Any info about people with autoimmune diseases that seem to put us... Yes, it's going to put you more at risk because your immune system is impaired, and you don't have the ability to fight this. I mean, you do... Your immune system needs to respond. And just like the people who say, oh, I got sick when I got the flu shot. No, you freaking didn't. Your immune system is responding to the irritant that is in its system, and it should be responding. You should have a little mild fever. You should have some aches and pains because your body is fighting what you just put in it, which is a good thing, okay? That's a good thing. You didn't get the flu. You didn't get sick. It's a dead virus, and you're not going to get sick from a dead virus. When I hear people say that, I'm just like, science. Science the crap out of it. That's what Z-Dog says. Science the crap out of it. And it's true. Because you're not going to get sick from a dead flu virus. I'm sorry. So do you think it... Oh, Julie, I'm sorry. I think what Ron blocked... I do block the haters. I do need rest, but... I do take the time to do this. Definitely file complaints. Make this documented. And they don't, the personal care aides. And you guys, it sucks that you have to freaking supply your own PPE. This is absolute BS. I've tried to look for PPE online, and it is so expensive. There's not enough, and people can't afford that. Can't use a mask on the face because you can't breathe. Do they think they need to stay home? It's hard. This is so hard with the mask issue because in a way it's a good thing, in a way it's a bad thing. If you can't breathe with a mask on your face, it's claustrophobia, and I'm going to have to tell you to meditate. Meditation is all about the breath. I'm off of my anxiety medication because of meditation. When you can control your breathing and you can control what the brain is doing and how you're freaking out, you can control... I can't think of a single situation where somebody couldn't wear a mask. I really can't. Severe claustrophobia, I mean, you want to die? Death, or you're scared to wear a mask? I mean, meditation. Get control over that anxiety because you don't need drugs. You do not need drugs to do it. You can control it. It is controllable. You just have to work at it. You have to want to do that. I can't think of a single situation that somebody couldn't wear one. They refuse to close once their employees tested positive. They need to be shut down. I'm sorry. If the employees are testing positive and it's spreading around, they need to shut it down. They need to disinfect because it's all over the goddamn place. Yeah, we need to keep fighting for healthcare workers and even the restaurant workers, and all the people who, and the little guys who are forgotten in all this. Just like I said the other night, my agency recruiter, those recruiters who got us out here to the front lines were working from home, working mad hours, no sleep. They're not out here, but they're getting us out here. And those people are totally not, they're a forgotten hero. Gosh, I can't believe how long this video went. You guys are just freaking amazing, man. Nursing home, yeah, these ones, there was a nursing home out here in Massachusetts that was hiding bodies. I'm going to grab my charger. Hang on. There was a nursing home out here that was hiding bodies out in Massachusetts, and I'm going to tell you what, that's absolutely not okay. Those family members didn't even know their loved one was dead, and to even hide bodies, where are you putting them? In a nursing home? I mean, they don't have a morgue. There's not a truck sitting outside. I got to figure out. Oh, is this metal? Yes, the coffee pot is metal. I can mount my phone to it with the charger on. Sorry, guys. I wasn't expecting it to go this long, but I'm going to answer questions as long as they're out there. But hiding the bodies in all these situations, this is a bad thing. This is a bad, bad, bad thing. There needs to be transparency, because if people don't see the honest to God things that are happening, which is why I shared that mucus goober, that has got to be the most popular mucus plug ever. But if there's not transparency, this is what's going to happen with the protests, because people are not seeing what's happening. They're not understanding. They're hiding things. We don't want it. Honestly, people react to the honest truth. And as hard as it is, it's a hard pill to swallow, but that's what they react to. And if you are transparent, I don't take any vitamins, Carolyn. I just don't like putting things into my body. I don't. I've gotten off a lot of medications. I was on a lot of psych meds with my husband that I didn't need, that were affecting me. I was passing out at work, and I didn't need the meds, and that's why my body was reacting that way. And I feel a lot better now that I'm off of everything, and I just don't want to put anything in it except for caffeine. That's my only vice. I don't even drink. When do we feel we are safe once they lift the order? When we start seeing a significant slowing of this, if we can maintain the social distancing and we're not getting the drain on the healthcare system, and we are actually, here's another goddamn problem. So the CARES Act that was passed, I don't know who was responsible for this part. I have not the time to research this in depth into it, but apparently it was attached somewhere in this CARES Act that if a patient is COVID positive, we get more reimbursement. And I thought that this was absolute crap, so I went and researched it, and in fact, it is true. So now we're seeing hospital admissions with people labeled COVID who are not COVID. Metabolic encephalopathy for a drunk is not COVID, rule out. But because it's going to have a COVID diagnosis attached to it, they're going to drain the Medicare system and the insurance systems to get more money in reimbursement, and that's not good. I don't want to see people labeled, because what it is doing is it is giving us the false count of how many people are actually positive. I don't need a bunch of skewed numbers because a bunch of people want to get paid more in reimbursement, and they want to screw over the healthcare systems. I don't want to do that. I don't want to see that. I want accurate numbers, so I know the data that I'm looking at in the future that we're basing vaccines off of, and the spread of this is accurate. So we need accurate reporting, and they need to go back and audit these charts after all this is done. There does need to be some accountability for this, because I don't agree with that. So when we start seeing a slowing of people coming into the ER and testing positive, and we start seeing a slowing of the symptoms, then I would start being comfortable myself, relaxing how I'm doing things. Right now I'm having everything delivered. I don't want to see a store. I don't want to touch anybody. I run in and run the hell out. I don't want anybody near me. 2 relatives, neither were obese. I have a little old lady. This is affecting everybody. It really is, except for it. What I'm happy about is it's not affecting a lot of children. There are some positive cases in kids, yes, but it is not hitting them. Thank God. Leave our kids the hell alone. They suffer enough with our craziness and what they're seeing. And how do you explain to a 2-year-old what's going on right now and to wear a mask? My friend was trying to wrestle her 3-year-old into Walmart the other day, and they wouldn't let him in without a mask. And how do you do that? How do you do that to a kid? The virus is out there. So now you got a kid paranoid of a virus. They don't understand the concept of all this. So it's traumatizing the kids too. There is a lot of confusion with our children. We do need to educate them. I was sick late December, 2 back-to-back aches and low-grade fever on anything, dry cough for weeks. Man, these schools need to disinfect better. Michigan State University was doing, I think it was a hydrogen peroxide atomizer type thing, and they were doing this on the airplane too, in between flights. Our schools need to do a better job of disinfecting after the children go home from school every day. Buy a fogger, fog the rooms. The kids are a great carrier for viruses. Even if they don't get sick, They are a great carrier just by nature because they're not washing their hands. They are little germies. They are into everything. So they bring it home to everybody. And it's scary. If you have pre-existing conditions, then you do need to worry about getting sick. So we do, look at the situation in the Detroit schools just a few years back. Like the whole gym floor was like pushed up, and there's mold growing everywhere. How the hell do you expect our children to go to school like that and people to go work in that environment? That's just ridiculous. I mean, this is what we're dealing with here, and we need to get control of this crap. It's not just during cold and flu season. That was my hard drive. Hold on. It's not claustrophobia. I have MS, heat and dew. Okay, I understand that. But what I do need you to understand is what the job of your nose is. The job of your nose isn't to smell. The job of your nose is to heat and moisturize the incoming air for your airways and your lungs. So you're kind of humidifying the air that you're breathing in. I understand the heat-induced allergy, but you are breathing at a certain temperature of body heat. So you're not really adding anything in there. I would suggest when you're wearing these masks, if that is what you're having as a heat problem, to breathe through your nose and not your mouth. Because, and I learned this from my stepson when I ate a lot of hot food down in El Paso. If you ever visit El Paso, the red sauce isn't Ortega taco sauce. It's freaking fire sauce. And I do mean light your lips on fire sauce. But he's a soldier, and he's like, breathe through your nose and quit breathing through your mouth. Because when I breathed through my mouth, it was causing the heat on my lips to get worse. So when you breathe through your nose, you don't have as much heat expelled. And it's actually meditative. Breathe nice and slow, and you're not going to hyperventilate. And you don't breathe through your mask, and you're not heating up that mask. Breathe through your nose, because that's what I do at work when things start getting foggy and I'm sweating my ass off. I focus on my breathing, and it's meditative. It lowers my blood pressure. And I've actually sat there and lowered a lady's blood pressure. She has an arterial line in, and she was like freaking out on the ventilator. They didn't want to extubate her at night because doctors have this big paranoia about doing that, but you can totally do it, and you should. But they had me come in and talk to her, and I made some vent setting changes, and she was spontaneously breathing on her own, and I coached her how to breathe properly and just nice and slow with the breathing tube. And when I left, I put the support back on the vent, and she was freaking out thinking I did something to the ventilator and wanted me to come back and fix it. I'm like, sweetie, you were doing all that on your own. And I watched her blood pressure while I was talking to her and coaching her drop by 40 points. So meditation and breathing does work. It does. I've seen it. How about the one with 50 bodies was found when they shut down to clean? Are you kidding me, Judy? I didn't see that. You're going to have to send me that article if you can find it. I want to collect these things because these are examples that need to not happen ever again. A Target not testing anyone and not shutting down. This is ridiculous. The Smithfield ham place needed to be shut down because they didn't follow infection control procedures, which makes me really cautious about buying Smithfield products. If you're not following infection control procedures, how do I need to trust that the food that I'm buying from you came from clean people? You're not going to get the coronavirus from your food, but you might get something else. And I'm not a fan of like botulism or salmonella or anything like that. So let's keep the infection down and start doing what we should be doing in the first damn place. The masks, okay, the mask effectiveness, the ones that people are making. Some people are making just plain cloth ones. Others are making ones with filters, which are better than nothing. What we want to do with this concept is to contain the spread of droplets from a person. So if they're wearing the mask, any containment is going to be better than nothing. As for trying to protect yourself in a healthcare situation, because like what I wear is the N95, and then I put the surgical mask over it, and then I change the surgical mask when I happen to go out of a room that's not COVID. If I go into another patient's room who isn't COVID positive, which is very rare, then I put a fresh, clean surgical mask on. That's going to help just filter out anything and keep my N95 from being contaminated throughout the shift because I only get one. But the cloth masks, it depends on the setting and it depends on the use. But if you're going out in public and you're trying to just stop the spread, it's better than nothing. Excuse me, the damn Diet Coke. If you are sick or you're trying to prevent getting something in a healthcare environment, I would not recommend them. I would recommend a surgical mask. But something is better than nothing. We live in a busy downtown college area. Walking your dog, if you're not walking, because this is not airborne. So if you're not really by people who are coughing and sick and, wiping their boogers on your dog and stuff like that, I really wouldn't be that. I mean, I would maybe clean off your shoes just to prevent any other bacteria and viruses from coming in. But being that paranoid over the COVID situation, if you are not that close to people and you're maintaining your social distance, we have to wear masks out in the public here in New Jersey, which is fine. Everybody's pretty much accepted that this is the way it's going to be for a while, and they just quit bitching about it. And that's really great because the people in El Paso are still posting all over Facebook how stupid it is. But it is what it is for right now, and it's protecting people in one way, shape, or form. And if they're going to supply them and they're going to help out, then great. But if you're worried about walking your dog and you're not right next to people and you're maintaining social distance, I don't, with the way that this is transmitting that we know as of right now, it's droplet, it's not airborne, and I don't think that level of paranoia needs to happen right now. Holy cow, I'm still going through testing. I can't breathe in this. I want to try. I bought a face shield. The face shield's at least going to protect all your mucous membranes, but it's not going to protect anything from getting up under it if a patient coughs at you. So if it splashes and it gets up underneath there, you're at risk. The surgical mask is better than nothing. You need to stay away from others if you can't wear a mask. Definitely, and still wash your hands and don't touch your face. Do I agree with Dr. Fauci and Bill Gates? I don't even want to talk about Bill Gates right now. I think he's trying to profit off this situation, and I'm going to leave it at that. Dr. Fauci, I don't know. I'm on the fence. I like to do my own research. I want to see the facts. Show me the facts. He seems to be gaining a lot of political and private what's the word I'm looking for? Reputation. I'm not a fan. I don't even like the way the man talks. He's kind of creepy to listen to. I would rather listen to Z-Dog tell me about it, because at least I know he's going to put it to me the way it is. Insurance fraud, Michelle, yes, very much so. Insurance fraud. This is a violation of Medicare, CMS standards and reimbursement. They're definitely defrauding the insurance company by labeling people with a COVID diagnosis who do not have any symptoms, not even a freaking fever, no inflammatory markers, no nothing, just a lot of other healthcare problems. Worried asked, great question though. Michigander here, thank you guys. You are freaking awesome. I cannot believe how long this damn video has gone. I just meant to be it short and sweet, and everybody's been responding. So, I mean, wonderful. Dogs, I don't know. When this first came out, they said that they couldn't transmit it. Like, it originally supposedly came from the bats to the humans, and then this mutation isn't transmittable by animals to humans, but now we're having animals testing positive. So I don't know what to believe. I'm on the fence about it. I would definitely not kiss your cat or dog if you're COVID positive at this point in time, or cough all over them, because I'm kind of weirded out by these tigers that are testing positive, cats and dogs testing positive. We definitely need research, and it's going to be interesting to see where this goes, because if it's animal to human too, oh shit, we're going to have a whole new problem. So I'm on the fence. I got to see the research. So is it true that I was in the doctor 3 times in 8-week period, excludes to me since I have malignant squamous cell skin? Yes, you do. If you have some kind of skin cancer, you do have a weakened immune system. You will continuously get sick from people. It would be advisable just to wear a mask to protect yourself during cold and flu season in general, just so you don't get it, because your immune system is weak. They won't wear a mask around probably. Kids are dirty. Yeah, it does, Adriana. It sounds bad that we say kids are dirty, but we know what, well, hopefully we know people have a way of taking things out of context. But Kids, they don't wash their hands. They're not as conscientious about not touching their face. They're sticking their fingers in their nose and doing weird things. In January, admitted to the hospital from work, AFib, 61 years old. Anytime you have a heart condition and we have a clotting issue, you are going to be at risk. Your heart is not functioning properly, it's quivering, and if you're quivering with thick blood, we have an issue. So if you get COVID, you are going to have a hypercoagulation issue. So I would definitely be considering wearing a mask. Yeah, and you guys, I'm sure firefighters, most of them are first responders, and they're the first on the scene before the ambulance even gets there. And they even do the assessments anymore, and if they need an ambulance, they'll call just to reserve the resources. So I would be very, very careful, again, because this is, dogs, cats carry COVID. I don't know if they carry it, but they're getting it. And I don't know if it's going to come from animals to humans. If they keep telling us different things, and we're getting this from China. So I'm on the fence, and it's better to err on the side of caution than it is to assume that, okay, they're not going to get it, or we're not going to get it from them. If we do have animals testing positive, it's very interesting. I'm going to put it that way, and I'm going to continue to monitor and do research and read the facts. Please turn off the fucking television. Please. These people on the news, every one of them has some kind of political agenda behind them. They're getting paid big bucks to get on that soapbox and preach their opinion. What happened to the news actually reporting the news and the opinions being reserved for the editorial section of the newspaper? I really want to see facts. People with breathing difficulties and respiratory problems, I do need you. I don't want to click on the link because I'm going to lose the comments, Judy, but I'll try to go back. Try to send that link to me in a private message so I can take a look at it. I'll lose my comments here. I'm trying to get comments everywhere. I know how Z-Dog feels now. We just need to stay strong. We do. We need to unify. We need to help out our neighbors who are struggling. If you have something that can be donated that they need, kindness goes a long way throughout this right now. It really goes a long way. And positivity. Look for this was a silver lining in a cloud right now. This was a way to wake up America that things need to change. And if this virus was being, made for bioterrorism, we put a stop to it. Because if this would have got out with further mutations, it probably would have started, these onset of symptoms wouldn't have taken 10 to 14 days. It would have happened immediately, and they could make it airborne. And I firmly believe by the symptoms that I am seeing that this could have been a really bad thing if it would have gone further. I think this was a good thing with it being released. I am so sorry that we have lost all these human lives over something like this. And we do need to hold those accountable who are responsible for the release of it and also for the production of it. Oh my God, there's 251 comments. Holy crap. I don't want people to be paranoid and scared. I don't want fear-mongering to go on. I want education. Make informed choices. Be responsible with your actions. That is the most important thing. Please be responsible. Educate, educate, educate. Don't belittle people for their party lines. I mean, like I said, I support my president because he's the leader of my country, and he is doing a damn good job. People don't like his attitude. I can't blame them. I think he's an arrogant SOB myself, but I don't have to like him for him to be doing a good job. Just like I love my husband, but I don't have to like him and what he's done to me and what he's put me through. But it has put me on the path to help other people. So there is a silver lining in all that misery that I've been through. So you really have to just try to find the positive in things. Are people with history of pleural effusions of unknown origin at higher risk? Pleural effusions always really baffle me because they just occur for some reasons or another, and we can't get rid of them damn things, and they compress the lungs. If we don't know where they come from, I don't know if they're going to put you at risk. I had a lady with lung cancer the other night that has a pleural effusion, and that's very typical. I hate getting called for a breathing treatment for a pleural effusion, though, because there ain't no damn albuterol in the world going to open up a compressed lung because of fluid. These doctors. If cardiac and lung issues are ruled out, then I would think that not at high risk, but I would really wonder where it's coming from, because there's a reason that fluid is building up in between that lung lining. And I'm just always amazed, because I have seen some serious amount of fluid come out of a lung lining. I can't believe people were breathing with that much fluid in there. Cleaning off your groceries. Your produce, yes, I would sanitize it, wash it in vinegar and water, because people touch it a lot. And that's going to be a high-touch item in a grocery store. And if people are wearing freaking gloves all over a grocery store, it just allows the virus to spread and smear easier. A cardboard box, however, and stuff like that, it's not going to hurt, but I would not be like overly insane about it. But I would wash my produce, because people are really touching that a lot. God, you guys are just freaking awesome. Seriously, I am it's just little old me in this hotel room. There's a lot of soldiers here who are working at the university hospital. They're in the medical field. High blood pressure and asthma, going back to work with preschoolers. I would encourage your children, if you are a teacher, you are in a prime position to educate these children and to teach them healthy hygiene habits that they may or may not be learning at home. Make a fun game out of it. I used to substitute teach, and kids are very engaging. When you teach them in a fun way, they will react and respond appropriately. You make a game out of it, and there was a video that my dad shared. I'll try to reshare it on my YouTube channel. I don't know if I can do that. I'm so new to all this social media platform stuff, but it was a guy who went into a classroom and he was showing how fast germs spread, and he put a powder that shows up in a black light on like 3 kids' hands and like one other one that knew about it. The other one, they had transferred it by shaking the teacher's hand. And when they got done for like getting ready to have first recess, this was all over the classroom. So if you can do it in a visual way so kids can see and understand what's happening, maybe even have somebody come in and do that, make it a game, and show them what happens when you don't wash your hands. And imagine that those are the sick, especially going back to school in the fall, we can use this experience as an example and a visual understanding for these children. You guys, you teachers are in a prime position to really educate these children and get them on healthy habits to begin with. So Z-Dog MD, he is a doctor who is a loose cannon, as he says, but he is championing the change for healthcare workers and the way healthcare is billed. The way healthcare is billed right now is on a fee-for-service type platform where the doctors get paid for so many hip replacements. Healthcare is the only profession where you can have a degree in something and manage a hospital but not have a medical degree or have any background in what you're managing. So what's happening is these healthcare administrators are telling these doctors, you have to do so many procedures and you have a quota. It's almost like you all talk about the cops with the speeding ticket quotas. Well, that's what these doctors are being forced to do, whether or not people need these procedures or not. A hip replacement on a 90-year-old, unless they're really mobile, that's going to put them at risk for hospital-acquired conditions and probably not making it out of my hospital after that hip replacement because they can't get up and do the physical therapy that they need. But the hospital is saying, do these procedures. So he's trying to champion the healthcare cause to change the way that we do these. He used to have a facility out in Las Vegas that was it was like a bulk package. You paid for a service per month and you could see the doctor. You could come in and do the yoga. You could come in and treat the body as a whole. And it was and you could get your medications and you could do all these things. And it is successful. It is a successful model because another healthcare corporation has picked it up and they're doing it in larger areas and they're also promoting it to other healthcare groups. The thing is, these healthcare insurers don't want to pick it up because the benefit of doing this won't be seen for a few years down the road and they want immediate results. Well, you can't have both. You need to be patient, just like right now in this environment. So it went out of business. He had to close the doors. It was in Las Vegas, but since then he spoke at my respiratory conference back in 2018 out in Vegas, and he continues to push for changes in healthcare reform. And he's very informative. He's a very blunt and loose cannon. He's a Stanford educated doctor. He's a hospitalist. I follow him. I don't always agree with all of his views. You know, he might have a different political belief than I do, but I do respect his opinion, and I don't have to call him names to respect him. I do follow him. I do support him. I do support what he's doing for us, and I do encourage you to go follow his page because he has a lot of great health information and a lot of funny videos that talk about healthcare, but they also have a very powerful message. So he's like a MD rock star, man. He's freaking cool. I've been following him for a few years now, and I really love his opinions. It's ZDOGGMD. You'll find him on Facebook, Zubin Damania. And I can't say enough good things about that man. He's doing a lot of great things. And he is my inspiration for doing this. And the reason why I'm answering all your questions right now, because he does the exact same thing for us and for his supporters. So he's also another person to fire questions off at. But he's like doing the same thing I am with the YouTube and Facebook platform and trying to read through the comments, and we flash him as many comments as you guys do. So I'm really trying. I understand what he's going through. What do you think of the movie? I don't watch movies, so I don't know. I can't speak on this movie. It might just be your connection. I don't think I'm frozen because I am seeing it on my live feed on my because I have my laptop on to read the comments because they're like not scrolling back on my phone anymore. I don't watch movies. I'm a very empathetic person, so I feel the emotion of the movie a little bit too strongly. But this is a problem, and this is something that we need to be aware of that can happen in the blink of an eye. This is a wake up to the American people and even the world that we need to be prepared for things like this. We need to plan. We need to plan for these things just like people need to plan and save money. Our banks haven't crashed. We're not in a huge recession. This is not what we were going through, what was it, 8-10 years ago? We're not in that condition. We have a little buffer to go before we get there. What's happening is normal. It's a normal response to what we're going through. The economy will bounce back. We will be strong, but people need to focus on buying American products, making America strong, and relying on ourselves to sustain us, not other countries. We can go ask them for help if we need it, or we can give it if we need it, but we shouldn't be diverting all of our resources to other people, and we should not be buying things off of Wish because they're cheap from China and waiting 3 weeks. It's worth a little bit extra money to pay for quality and to pay for investing in our country. Prophylactic anticoagulant. I don't know the answer to that. I have so much research to do. I'm switching over to day shifts, so hopefully tomorrow night when I get off work, I can watch some of these. Don't read the news. Can you recommend reliable sources? The American Journals of American Medicine, if you go to like the accrediting agencies, I don't even trust the WHO or the CDC. The CDC is the one that told me it's okay to wear a cloth mask to work if nothing else is available. I don't freaking think so. But I would go to the accrediting agencies, the American physicians, all of these places. We have the American Association of Respiratory Care. They're the ones who research these things. You can get the actual research articles, and I'm probably going to have to do a video on how to read those because it's a real pain in the ass. You actually have to start down at the bottom and then kind of pick your way through the methods and then look at where they got their sources from, because there was the one article that looked really good about the heme attachment with, what the hell was it, zinc, I think. I can't even remember. There's been so much bogus stuff posted, but it was a really well-written article and research. But if you went to the actual sources where they got the research from, those weren't credible. So it's a really easy way to manipulate things, but if you go to the actual physicians and the respiratory groups that actually do the research and spend the time and money to do this. That's why we pay our dues to these people. That's where you're going to get the real information, and people will pull certain data out of that and skew it, which is what's happening on the news. And that's why people are having a hard time believing anything that they're reading and seeing, is because they don't know what to read and believe. And that's where that's the problem, is we're spreading all this misinformation because social media allows it. And it really needs to be filtered, but freedom of speech. But this is Facebook. It is a platform. They do have the freedom to contain what you put on their platform. You can get your own website and you can make your own platform and do it yourself. But, who has the time and effort and money to do that? Yep. Gosh, what time is it? I don't even know what time it is. Oh my God, it's freaking midnight out here. I did get direct message from Marissa. Oh my God, there's 289 new comments. You guys are crazy. I understand the questions though. Oh my gosh. I mean, this right here shows me that education is what we need. Education is what we need to help to help stop the fear mongering. If we give the resources and the education to help people, the insanity that we're seeing in the protest, yeah, people want to get back to work. We all want to get back to work. I'm not happy I'm working. I don't want to be doing this job. I got people dying every day. The nurse I took care of died. I don't want to see that. My coworkers are freaking devastated. Nobody wants to see that. We don't want this job. We don't want to be here. We would love for you to be home with your families. We would love to be going out to eat instead of sitting in our hotel rooms, ordering Uber Eats from restaurants that are like, I don't know what's going on out there. I would like to go shopping and pick my own produce. Yeah, we all want to do this. I mean, I'm tired of ordering through Amazon, but it is what it is. We can make it work for a little while. We can be innovative. And I try to, there's a lot of Facebook groups out there. There's like up in New Hampshire, they created a Facebook group for the people, like all the fishermen, so they can come sell their fresh fish because the markets are closed. So the people can meet them at the dock, and you get the fish right in the lobsters. Oh, these lobsters look freaking good. I'm ready to go to New Hampshire. But you can get them right out of the water, so they're not handled by anybody. That needs to continue. Cut the middleman out and go right direct to the person who's producing it. Save some money because that gets marked up. And they're profiting off of the work of somebody else. That needs to stop. We need to continue to support things like that. Co-op markets are freaking great. Places like that, check out your local farmers markets if you have them. I participate with my arts and crafts in my local farmers market, and they're awesome. They are an awesome group of people. Continue to do it after this is over. Wow, I'm trying to... What diseases make you a higher risk? Anything that's going to compromise your immune system or your respiratory system or your cardiovascular system, any of that. Obesity makes you high risk for everything. I'm sorry, but being obese, your body is functioning at totally different. I mean, it's impaired. You're at risk for diabetes. You're at risk for a lot of things: obstructive sleep apnea, hypertension, heart disease. So, you don't have to be a supporter of him, Darlene. I just ask that you support the country. Okay? That's what needs to happen. You don't have to support him. You do not. I'm not begging you to. I'm asking you to help support this country and do what this country needs to get through this, and not hate and spread negative things just because somebody voted for him or because they're a Trump supporter. Being a Trump supporter doesn't mean that somebody is something that they're not, and you're labeling somebody and assuming things that aren't true. I'm a Trump supporter, but I'm on the Democratic side when it comes to locking down and containing the spread of this virus. I don't have to agree with him, but I do support him because he is my president. And if he's not your president, you're in the wrong goddamn country. I'm sorry. All those who want to move to Canada, free to leave. Go. Whoopi, Rosie, all of you, you're still here. He's still your president. We're in America. He is Donald J. Trump, the president right now. I voted for Obama, unfortunately. I was not happy with healthcare reform. It's a fucking nightmare, thanks to him. But it is what it is. We can't agree on every single thing. It would be a very boring world if we did. But we do need to support our country, and that's what needs to happen, and the people in it. You don't have to support him and agree with him and do everything he says. But right now we do need to contain the spread, so I do ask that you follow your governor's guidelines. Yeah, they're out of inhalers, so we're not supposed to give nebulizers in the hospital to these patients. We're supposed to give the MDIs. Well, guess what we don't have? Inhalers. Guess what my asthmatics don't have? Inhalers. So there was a quick national shortage on those right after this. So now people don't have the medicine that they need, and we do have to give the nebulizers. And I'm sticking filters on the end of my nebulizers to help contain the spread of this, which is not the best answer, but it's better than nothing. I just make sure I kind of stand outside the room and pray. I pray a lot. I wear my PPE and I wash my hands and I protect my eyes. I can't wait for my anti-fog goggles to get here because these glasses suck with face shields. Tried to link his page, but it won't let me. Sorry. Tina, oh, I'm going to say you guys can send it in private messages. 311 comments. Just happened to see your rant video back here because it was real and straightforward. Oh my gosh. Yes, that was a great video, Stephanie. I haven't watched this, but I can already tell with the black light that this is exactly what I was referring to. That's the classroom video. That's exactly it. I have back surgery that's pending, and I'm still out here on the front lines fighting, but my elective surgery got withheld at the Army Hospital back in El Paso. I mean, it sucks. I would love to not be in pain, but it is what it is. I don't want COVID, and I don't want them spreading it all over the hospital either, because hospital workers are not clean people. They need to wash their damn hands. They're the #1 spread of hospital-acquired infections, is getting it from a healthcare worker who is not a clean, hygienic person. They don't have religious practices. They don't follow the directions. You know, this is a classic case of the reason why we need to be told what to do right now, because even though we're supposed to wash our hands in between patients and in between tasks, it's not happening, and people are getting sick every day because of it. It's live with a speaker giving answers to questions based on science when opinionated it's indicated. Thank you, guys. I mean, I'm trying. I mean, the best thing that we can do is educate. I mean, people are going to be non-believers. They're going to be skeptical. We do have our conspiracy theorist out there. I have a friend, William, who likes conspiracy theories a lot, and I have to contain him sometimes. I love him to death, and it is great for a debate and possible consideration, but a lot of them are just conspiracies because there is no transparency. If we had transparency, Darlene, I'm not sure what you're referring to. Are you talking about Z-Dog? Got over 90 people in here. God, I had I can't believe it's midnight. And the questions are still going strong. This is just amazing. You guys go to sleep. I'll try to answer some of these questions and maybe do another live video. I am off work on Wednesday. I work Monday, Tuesday day shift, so I'm off on Wednesday, so maybe I'll do another live video then and answer some more questions, because I am getting a lot of respiratory questions and questions on oxygenation, and I will try to share some of the videos to my page. I have made it public commenting. As long as the public comments are respectful and there's no hate speech going back and forth, I will leave the comments open. I will not deal with hate speech. And I will ban anybody who wants to get in here and do that to people, because I don't put up with it on my combat veteran spouse page, and I will not put up with it here, because that is not what people need. They do not need to be attacked. They do not need to be criticized for their views and their questions. There's not a stupid question. Remember that. There is not a stupid question, and I don't mind answering questions. I will do it as long as people have them. It's important to educate, because that is how we are going to contain the spread of this. If we have people in fear and paranoia because their questions and concerns aren't being addressed, that is what's going to continue the bad practices and the things that people shouldn't be doing, because sometimes they just don't realize it. When you see somebody touching their face in Walmart, say something. Do it nicely. Go, but hey, you got gloves on and you just touched your face. If you're worried about the virus, you really have to, and then they go touch their phone and put it up to their face. Do you realize what you just did? A lot of times they don't, because it's a subconscious habit. And I stop people all the time in Walmart Do I personally have enough PPE? No. No, I don't. I would like more N95s, real N95s. I showed the Chinese KN95 that I'm getting. I shouldn't be getting that. But there are people who have nothing, so I'm not going to complain. I just make sure that I double down. I wear my other PPE. What we're on a shortage of. I actually ordered a set of Frog Togs to wear because they're washable, but we're supposed to wipe down our white Tyvek suits with sanitizer wipes every day. What if I miss a spot? I don't know if everything's wet. I can't bathe in them because all those sandy wipes are not available, because when I went into the closet last night, there were none there. So now I'm grabbing alcohol wipes to clean my equipment with, and I don't have the sanitizing wipes to wipe down my Tyvek suit. So, no, we don't have the supplies that we need. There is a shortage, and I don't know if it's the hospital not stocking things. I don't know. So I try to be very, very careful. I have a surgical gown that I wear over my stuff. And what I'm lacking is the yellow gown that I wear for isolation when I go into the patient's rooms, that I'm supposed to change every time I go into a patient's room. Guess what I don't have to change? A yellow isolation gown. I just have a surgical gown that I wear from room to room to room. And if I don't have yeah, they're treating everybody as COVID, but, you know, the alcoholic who's in there for metabolic encephalopathy, who doesn't have a damn COVID symptom, who we're ruling out COVID on, he doesn't need to be exposed to my gown, or my hair bonnet, or my booties that I'm dragging into his room. And I can't just take them on and off because they're all being handed out at the beginning of the shift. I don't have free access to my PPE anymore. I used to be able to go into the closet and go get these things, and they're not there anymore. They're being regulated by an administrator. That's a damn problem. It is. So no, I don't personally have the PPE that I need. Yes, there is a shortage of inhalers. There are the nebulizers, so we do have the fluids and the nebulizers to do. Yeah, share the shit out of Z-Dog, guys. Please, please, please. He is freaking phenomenal. If you have the funds, it's like $4.99 a month to support him on Facebook, and you get access to the supporter hub. And he's able to respond easier to the supporters because they're all in like a certain area. I subscribe to him because the content is great and it is well worth the $4.99 a month. I can go without a few soda pops at the freaking grocery store just to support him, because what he's doing, he is getting a lot of heat for what he's doing. He's getting a lot of backlash from hospital administrators, but he will have people who don't agree with him on his show, and they will have a decent, respectful conversation, and it's great. The interaction is great, and he shares those videos on YouTube as well if you don't want to follow on Facebook. But Z-Dog is the bomb. I cannot say enough about what this man is doing for all of us and the voice that he is giving us. And he's the one who gave me the voice to do this. And I cannot believe the freaking views that I have gotten on that damn mucus plug video. That is, like I said, the most popular mucus plug I've ever seen. Most people are like, I don't want to see that shit. God, Frog Togs are great, and they're washable. I mean, they're only $16 for a set. I'm ready to just buy some and take them off every day and not bother to wipe them down, put them in a bag and bring them home, because there's a laundry service out here too, by the way. I want to thank these people. It's Lotus Laundry, and I caught them when I was walking back in from the hotel because I was sitting here wondering, I got this gigantic pile of clothes. How the hell am I going to wash them? I don't want to take them in an Uber. And they were coming in to bring somebody else's laundry. And all she did was ask me when I dropped them off, do you work at a nursing home or a hospital? And I'm like, yeah. And they just take extra special care with it, and they make sure to boil that crap for me. But they brought it right back here, folded and smelling beautiful today. So thank you for helping us frontline workers and not discriminating against us because we're covered in COVID. Because if one more person attacks us with Lysol, I'm going to beat them with a can. That's not nice. Yeah, feel free to message me questions, even if I can't, like, if I get an influx of so many that I can't answer them, I will write them down and try to address them in a video. Frog Togs are a rain suit. Oh my God, I just got, like, all the 300, me and my fat fingers in this stupid computer. I'm going to have to update my computer, but I'm trying to go back through the questions and read the comments. I do sleep. Um, I do. I get the sleep that I need. My body's like 5, 6 hours and I'm done. I already had my shower for today, so I can just get up in the morning and drink my coffee and go. Had to switch inhalers because my old one was not available. Dorothy, what medication were you on? Curiosity. If it's a different type of albuterol inhaler, it may have been a good thing. I am not a fan of Pro Air. I find it to be a very cheaply manufactured and ineffective inhaler. I'm more of a fan of Ventolin. And what's the yellow one? God, it's been so long since I've administered some of these medications to remember the Ventolin, Proventil. Those ones are better than Pro Air. Pro Air is made very cheaply. And I want to tell you guys something. If you have medications that you cannot afford, or you are on a plan like Medicare and you cannot afford them, if you go to the look at the manufacturer of the medication that you're taking and go to their website and look up patient assistance applications. If you do that, they have patient assistance programs for you, and they will send. I got my Lyrica sent to me, my Chantix, when I didn't have insurance. So those resources are there. If you have to pay for a website to tell you this, that's ridiculous, and they're cheating you out of your money. Just Google the patient assistance applications. It's literally a one-page application. You just have to fill out the questionnaire, and your doctor writes the prescription, and you send it to the company. It is a really simple and very easy process. And there's even some providers that are enrolled, like with the Advair, and you get like an insurance information to take right to the pharmacy, and you can just get it right then. They're great programs and very little known. Please check those out and don't overspend for medication that you cannot afford, because there are plans out there to help you, and you should not be getting charged for that help. Let's see. Thank you for the clarification. Do you personally? I think I already read that one. Okay, I got back up to where I was. My pharmacist said that, yeah, they're out. God, you guys are just freaking spectacular, and you're supporting one another. This is what I'm asking for. You know, you're helping each other out and answering each other's questions. And if you have the access to the, the information, that's what you're doing. That's what I want to. This is what needs to happen. No, hospitals should not be for profit, and you are very correct, because the medical industry has turned into a patient farming money making machine, and this is why our healthcare costs are out of control. This is why you can't afford your healthcare premiums. This is why you can't afford Medicare. This is why you can't afford your medications. It's because of this right here. This is what Z-Dog is preaching. Please go to his page and support him. Follow him, because his message is very, very important. Healthcare costs are out of control. If you look at other countries, telehealth medicine is very important right now. And what we're seeing is that people are visiting the hospital for reasons that they don't need to be visiting the hospital for, that can be handled over the phone or in a video chat. I just did that this week with 2 of my providers. I'll happily pay my copay for that, just so I don't have to go into a damn office and waste my time. Call me when you're ready, and I can have the time to answer the questions. And what Z-Dog had at his facility in Las Vegas was the ability to come in and talk to your provider for as long as you freaking needed to. If you had questions that needed answered, like we're doing right now, he had the time to take to do that. His providers were able to do that, and that's what we need. People, we keep telling patients to speak up for yourself and educate, but yet we don't have the time to do that with people. How do you expect them to learn if you don't have the time to spend with them because you have a 13-minute time slot? What the hell can you learn in 13 minutes other than your test results? And there's a really great Mayo Clinic video I'm going to have to share. Again, I think it's Mayo. No, it's the Cleveland Clinic. But it's about compassion, and we have to watch it in a lot of hospital orientations. And what it is it's a video going through the hospital, and all these people have these little bubbles over their head. I just got diagnosed with cancer. I just got married. I just got divorced. And it's like about human compassion, because you don't know what somebody is going through. You need to just have compassion and empathy for people and try to understand. And when you can get down on that level and try to relate to them, because when you give them bad news or you give them confusing news, their mind is already working and they're not hearing the information that the doctor or the provider is giving. So they're going to have questions after they leave. Then what? You don't have a phone call. You call the office and the nurse is nasty. That stuff needs to stop. And we need to revamp healthcare because it will also reduce healthcare costs for everybody. Sweden is a great example of what needs to happen. And their healthcare costs are like beautiful. 50% of our GDP is healthcare. It's healthcare related in some way, whether it be the cost out of pocket, the cost of healthcare, the cost to provide it. 50%. That is ridiculous. Imagine what we could do with all that money. You know, there's a lot of hungry people in our country that could probably be fed and housed, and our veterans could be taken care of better. There's a lot of things that could be done. So we really need to get that under control. Please watch who you're voting for, because these career politicians need to go. We need the little guy, and we need the people that actually represent American people. Because what we're seeing now is that these essential workers, the grocery store workers, the gas station clerks, the little guy, they do matter, and they are what keep this country going. Our truck drivers, these people need better, because they're the ones that need to be, we're the ones that need to be represented. Not big pharma, not these big CEOs and corporations. All the work we're doing is lining their multi-million-dollar pockets. There are people with great inventions out there that deserve a chance to make a profit on something that they took the time and effort to invest, not sell it to another company to make a lot of freaking money off of, while that guy just sold his patent for dirt cheap. That needs to stop. This Shark Tank thing on TV is not entertainment. That's robbing the person that came up with those ideas. And that's what needs to stop. These CEOs are making a big buck on these people's inventions, and there needs to be better representation, and this needs to stop. Please support the people who actually make this stuff, because these big companies, they're not the ones that come up with this. It's average folks like you and I who have had enough of this crap, and they have created this stuff, and they've poured their blood, sweat, and tears and their lives into this, and they're being robbed of the recognition, and they're just being shown on television going in front of the Shark Tank, who is like rude. I don't want to stand in front of somebody like that. Screw you. I'll go find somebody else. That's how I felt about Donald Trump on The Apprentice show. I was happy he got fired. Very happy. I didn't like his arrogance, but he's doing a damn good job with this country. Try the Green Label Coke. I only have these because, and I do drink Coke Life, and actually I had ordered the Mexican Cokes from Aldi, and they were all out. And if I'm going to drink sugar, I prefer it to be the real sugar. And I miss my Mexican Cokes in El Paso, but they were all out at Aldi. And that was all there was in there, because I am not a fan of aspartame, and it's actually killing my freaking stomach right now. But they didn't have any regular Cokes down there. And, you know, it's better than aspartame. Not a fan of high fructose corn syrup. If it's going to be something bad I'm putting into my body, I'd rather it be all natural. But I do usually drink the green Cokes if I have a chance. I actually think that they taste better. Yeah, Pro Air, yeah, there is a difference. And please, if you have an inhaler, use a spacer. A spacer device is really important. Let me explain why. When you can't breathe and you're in a hurry to use that inhaler, you're spraying most of that medication on your teeth and on the inside of your mouth. It is not going down to your airways where you need that medication. So when you're like really desperate and having an asthma attack and you're panicking, you're not coordinating the hand breath thing that needs to happen when you're using an MDI. So if you use the spacer, you can spray that medication into the chamber. It's not going out until you breathe in and you're ready, because it's valved. That valve opens when you breathe in the spacer device. So you can spray it, and then you can collect yourself and then breathe in. You are going to get 70% of your medication. When you spray that inhaler, you're getting about 17%. That's why you're using 4 or 5 puffs. It's because you're not using it right. And you can conserve your medication and get better medication delivery if you use a spacer with your device. Make sure you wash it once a week, because it does build up the film in that anti-static chamber, and then it's not anti-static anymore. A cardboard tube is not going to work. A cardboard tube is not anti-static. It does not hold the molecules in suspension in the chamber. The plastic inside the chamber is anti-static, so the molecules do not stick to it. A cardboard tube does not have that. It's better than nothing, but I'd rather you have a spacer device. Are you a doctor? No, I am not a doctor, Shannon. I am a respiratory therapist. I deal with the lungs, airways, and breathing, but I have to understand how all of that works the rest of the body, because the cardiovascular system is a pump. They work together. So we all go through the anatomy and physiology and all the all those classes. But what's amazing with the respiratory system is that how much it affects the rest of the body. And if the heart and lungs aren't working, the rest of your body isn't going to work. And I do work in critical care. I've done emergency room trauma. I don't work on the floor as much just because I like the chaos of the ICU and I like playing with my ventilators. So I'm not a doctor. Definitely not. Z-Dog is a doctor. Definitely. But we learn a lot. I've been in this for 10 years. I got into it because my daughter was born with breathing difficulties. And it was found, she was diagnosed with asthma from an early age, and it wasn't asthma. She had juvenile rheumatoid arthritis, and it affected her lungs. So I had a respiratory therapist at East Tennessee Children's Hospital after the doctor told me to make sure that the respiratory therapist did not mix these particular medications, and I woke up in the middle of the night to her administering my daughter a breathing treatment, and I asked her what she was giving, and she told me, and I told her that the doctor said not to mix those. And she asked me if I wanted to do her freaking job. So here I am. I used to do heating and cooling. But those gas laws apply to the ventilator as well. I had to learn all about the gas laws to do heating and cooling. So it kind of gives me a little bit better advantage with that mechanical ventilator, because I really do understand how the pressures work on the body and how they work with the gases. QVAR is actually a better inhaler, from what my daughter's pulmonologist told me when I was in and out of the pulmonology office with her a million times as a kid. But QVAR is more expensive, but the molecules, I understand, are a little bit more, they're smaller microns, and they deposit better in the lungs. Pulmicort is still a good medication. Definitely rinse your mouth if you're on any inhaled steroids, because you can get thrush and it can get all over your chest cavity. ER nurse, awesome. My husband gets his Symbicort for free. Yes, a free coupon from the manufacturer. These drug manufacturers are awesome. Oh my God, Angela, I want you to look up GoodRx, because I have to pay cash out of pocket for some of my medications because the insurance will only pay for one in particular drug classes. We're playing that game now. GoodRx has a lot of good coupons. Also, get on the manufacturer's website, please, and because if it's a life-saving medication, they do have these programs. Medical field ripoff starts when they make students take 4 years of college in order. Yes, Z-Dog has a good point about this too, Adriana. Medical school is a ripoff because you get a bunch of old books, a bunch of old theories that no longer pertain to performing in the medical field. We don't even use them anymore. The theories are there, but a lot of this stuff can be done online. And these doctors are going into severe debt to become a doctor. And I've heard from many doctors that they would rather have just become an NP or APA. It would have been, you're not facing the malpractice, you're not facing a lot of things. You're not going into student loan debt over this. So yes, 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 yes. That needs to stop too. Proactive with medical issues. Let's see. Thank you for sharing the meds. Inclusive for $5 a month. That is awesome. That is awesome. I love hearing these things from the community. I don't mean that people do not know about their. So many people come in and don't know about their medications or even what they're taking or what for, and that's scary. There was a housekeeper at work that didn't take her blood pressure medication, and she was starting to see spots last night, and I'm like, you need to stop what you're doing. Sit your ass down, and we need to have you looked at, because this is, I don't need you. People can have ground level falls and hit their head and die. I have seen it time and time again. Just a simple, small fall, and then I can have people fall 30 feet off a ladder and be perfectly fine. We don't know. That's the amazing thing about all this Science is not perfect. It's science. And research is always needed. God, you guys are just spectacular. I have an asthma, dry cough for a month. Do you get a spacer for an... Sometimes you can get your spacers. Sometimes the pharmacies have them if you get a prescription. Other time the doctor's offices. If you go to the hospital, they should usually give you one. Most respiratory departments have their spacers. I don't think I'm going to change my mind about Trump. I am actually very happy with the way he's handling this pandemic, Kelly. All of us healthcare workers in the very beginning of this pandemic, none of us took it seriously, and that was coming from information overseas. When we started seeing what was happening, we reacted properly. That's not Trump's fault. You need to lay the blame where it belongs. None of us took this seriously. You can see me in videos back when this started happening. This is just like the flu. It's just, nope, it's freaking not. But when we started seeing, because it takes 10 to 14 days to incubate, when we started seeing the first signs and what was happening, he locked it down like he should have. You can't get testing for things that don't exist. I mean, you can't pull shit out of thin air. I mean, that's what you people are asking him to do. It's been 50-something days, and we have come this freaking far. We have gotten people money in their pockets. We have gotten testing, whether it be flawed or not, but that's what you get when you force things to happen fast that need to be tested. You need to test the accuracy of the tests that we're giving. We don't have a vaccine. We don't have a treatment because this is a novel virus. It is new. We have nothing because it is new. To create something out of nothing because we had nothing to test it on in the beginning, I don't know what you're looking for here. I don't know what answers you're looking for. I know you want somebody to blame, but you need to blame China. This is where this started. Their delay and their reporting is what caused all these worldwide reactions. It's not just here. And I know you need somebody to blame, and I know you want to be angry, but you need to direct that anger into action. And action doesn't mean standing on the Capitol steps screaming coronavirus in a cop's face. You need to be proactive and ask what you can do for your country. What can I do to help this process, not hinder it? Because all this hatred is just hindering things. It's going to cause this to keep going and drag out. If people would just get their shit together, do what we need to do to stop the spread and get back to work, because everybody wants to go back to work except for the ones making a lot of money on unemployment, this would go a lot faster. We're not trying to hinder this country, and he didn't do a damn thing wrong about this pandemic except probably speak too much. He should probably have somebody else do the press conferences. I really miss Sarah. I really do. But he should probably not speak. He's not a good public speaker, and he does not do a good job at reassuring the country like Obama did, but Obama was a great speaker, but a great liar too. So I have no problem with the way Trump is handling this. Our economy is freaking strong. I have money in my pocket. The stimulus money is rolling out. He's been putting up with a lot of shit, and he's been doing it well. I don't think Hillary Clinton could have done a better job, because Benghazi. And I'm just going to leave that there. You can get a prescription, but I found the same thing on Amazon for so much less. Oh, yeah, you could probably get a spacer on Amazon. I see them for pets. They actually make, because there are pets that have asthma responses, and they make pet inhalers. They should be cheap. I don't want to see you paying out the ass for a spacer. If possible, did hands-on training or volunteer. That would be a great idea, Nina. If the hospitals did more outreach, I do like these ideas. See, this is what I need to hear, because this is what I relay to hospital administrators when they ask us for suggestions, because people do need to learn and what they can do to help. And they need to have a volunteer network to help outreach into these communities, that the ones that are stuck at home who can't get out and they still need protection, you know, because when we go into hospital rooms of positive patients and like they send in like the rad techs to come take an x-ray, the patient has to wear a mask too. They need to be, everybody needs to be protected right now. Oh my God, you guys have been going for a couple hours. This is freaking crazy. I am just, I don't even know how many video views. I mean, it was up to like 230,000. I did this Thursday night, and I was just upset over guns and everything being brought out over Corona. You know, I understand we all have our opinions, but if we can be respectful, we'll get a lot more done. If we are hateful and we just continue to keep pushing negative things and negative agendas and negative, we're just shooting ourselves in the foot with this. This is not productive. It's not going to do anything. This has been a productive conversation, and I'm really happy with how this turned out. I am really excited because Z-Dog, you freaking rock. You are the one who inspired this, and you are helping other people by giving other people like me the opportunity to speak up. And I'm just surprised my ranting over a goober like it really resulted in this. As a therapist, I am really happy that this is what's resulted in this, because this has been a very educational and informative conversation for a lot of people. And it's given me a lot of feedback to take to hospital administration when they're looking for ideas on how to, you know, improve, because they do have performance improvement processes, and there are good hospital systems that do give a crap. There are, and those ones need to be commended, and they need to be like the representation of what hospital systems should be, because they get a lot of negative feedback just because, I mean, people don't get the answers that they're looking for, and instead of educating and helping them, that's where all the anxiety and the animosity comes with our healthcare providers. And there are shitty healthcare providers out there, folks. I am totally in agreement with that. I work with them all the time. I do file complaints, and you need to do that too, to the appropriate agencies. Definitely, because things need to change. Oh my Lord, you guys are great. I am probably going to wrap it up. Just 277,000 views and 18,000 shares. Oh my God. You guys are crazy. Thank you. Thank you, thank you, thank you. And I want you to know I am here to answer questions. Write them down. We'll do another live video in a few days when I'm off work. I'm going to science the crap out of some stuff like Z-Dog says, and try to catch up on the research that's been put out, because COVID changes every day. But this is going to change what we know is normal. And we need to start really, no programs here in Anchorage. You know, Nina, I am going to try and take a travel assignment to Alaska this winter. I really want to check out Alaska. I am a cold weather lover. It's a place I want to visit, so I'd be really curious to see how they do things up there, because it is different. It's another different culture and environment up there. I would definitely be interested in checking it out. Thank you, guys. I'm going to go ahead and wrap it up. Everybody get some sleep. It is like 12:30 in the morning. Oh, my God. I'm going to be curious to see how long this video is. I don't even know if I'm going to be able to download it and save it. I'll probably have to save it to one of my terabyte hard drives. But you guys are awesome. Get you some sleep. Write your questions down. Continue to message me. I will write the questions down, and I'll try to, you know, if it's something I don't know, I will try to get you the answers. Just wash your hands, please. Wash your hands, wash your hands, wash your hands, wash your hands, and do it right. Sanitizer, I'm not a fan of. It works in place of washing your hands. But please wash your hands. Please, 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 and keep doing it. And don't spread this stuff. I love you guys, and you have a great night.